So silang tatlo na lang sa
Tumaan kayo dito, pwede mo kasi ito Facebook live stream. Ano yun, sir? Hindi, pamaya pa. Paano pag naman siya, sir? As fast as you
The healthiest, most energetic, most useful you is right here, in your cells. They're coated with the power to create vital health. We've learned how to nourish them with good food and good nutritional supplements.
And what was the foundation for this company? And I was impressed to see that a microbiologist was the founder, not a businessman. And I was always impressed with that. And having spent a good part of my career working with USANA, opening countries for USANA, we just opened recently in India. And I was working in the Philippines 15 years ago when we started here. One thing that's very consistent about what we do is the science around our products. The foundation of everything that we do, it has to be science-based, it has to have meaning, it has to have influence on the health of our communities. And that's a big focus for us. And so I just wanted to thank you for taking time out to be with us. There's some really great people here. Dr. Maddela is an incredible influence on the direction and future of our product development, where we're going. And so again, thank you for being here. It's a great privilege to have the opportunity to meet with you over the course of the day. I'm looking forward to sharing some time. Thank you.
Thank you very much, David. Now, also, I'm privileged to present to you the original Vice President for Philippines, Thailand, Korea, and Japan, Mr. All right, sorry, we'll have that in a moment, in a little while. So thank you very much, Sir David. Now let's carry on the momentum forward as we continue to explore the vital role of supplementation in maintaining optimal health. Now, up next, we have a topic that's fascinating as it is vital to our well-being. We're about to dive deep into the science and evidence behind gut health. Our gut plays a crucial role in our overall health, affecting everything from digestion to immune function and even our mood. And to guide us through the complex yet intriguing topic, we have an esteemed expert joining us today. So stay very relaxed and get ready to uncover the secrets of gut health as we welcome our speaker on stage. Our first speaker has a total of 20 plus years of experience in clinical practice, teaching research and developing knowledge translation tools in the educational, healthcare, and pharmaceutical industries. He also holds the following degrees: Bachelor of Science in Nursing from Perpetual Health College of Nursing, Master's of Science in Biochemistry, Doctor of Medicine from the University of the Philippines with Master's Thesis, Circulatory Forms of Organic and Metabolism of Nicotinic Acid and Nicotinamide, Master of Science in Epidemiology from London School of Hygiene and Tropical Medicine at the University of London. For fellowship, he got the following: Fellow Philippine Society of Oncologists, Fellow Philippine College of Physicians, Fellow Candidate Palliative Medicine, Institute of Palliative Medicine, Fellow Candidate Palliative Care, Institute of Palliative Medicine, Clinical Fellowship in Medical Oncology from the Philippine General Hospital. Clinical practice are as follows: from Asian Hospital and Medical Center, Jose Reyes Memorial General Hospital, and Philippine General Hospital. For teaching, Tanya. Okay, I think it'll take a little long while for you guys since it's a quite early morning. So for teaching, he's a former clinical associate professor from the University of the Philippines College of Medicines, where he taught molecular biology and biochemistry of cancer cells. He's also a former associate professor from De La Salle University College of Medicine and taught immunology, genetics, and biochemistry. For his research and publication, he got the following: 8 years in evidence synthesis, clinical guideline development, and knowledge translation, Canada. 8 Scopus Index Q1 and Q2 international peer-reviewed publication in transfusion medicine. 10 local peer-reviewed publication in oncology and vitamin metabolism. And his book, Ambiguities of the Body, 2nd edition, Poems and Essays on Illness and Healing, 2018. Ladies and gentlemen, it is my pleasure to present to you, and please welcome Dr. Yves Lanael.
Good morning. And then a long journey forward, I learned how to synthesize evidence, translate knowledge, and ultimately connect the two. So your mechanistic and clinical outcome, it's putting them together is the love of my life. So let me start now with my presentation today. Disclaimer, okay? Importante yan. Baka magalit ang USANA sa akin. Okay. Now, the very first thing that we should realize is what defines a healthy gut. And there are many definitions now or criteria. One is effective digestion and absorption of food. So, ibig sabihin, mga signs and symptoms, walang nausea, vomiting, constipation, diarrhea, and there is normal frequency of bowel movement. There's also the so-called absence of GI illness. No, so there's no IBS, IBD, and all those gastrointestinal upset. And then there's the normal and stable intestinal microbiota. And this is one of the most important characteristic in the ecosystem of the gastrointestinal tract. It's the presence of stable and normal intestinal microbiota, which I will elaborate more in this presentation. And of course, the GI should have an effective immune status, meaning to say that the GI is not so reactive to certain allergens or drugs. So there's no such thing as drug-induced diarrhea that is manifested by an individual. And of course, the status of well-being. Later, I'll tell you that the GI plays an important role in our overall health, in the optimal health. And that actually affects the overall quality of life. And when we talk of quality of life, we talk of the physical, the mental, the social interactions that we have in our life. Okay, one of the most important aspect of a healthy gut is really the presence of a normal population of microbiota. Let me just explain to you certain terms. So when we talk of microbiota, this involves diverse group of microorganisms that are found along the gut, along that lumen of the gut. And these are made up of bacteria, viruses, fungi, etc. But there are certain groups of microbiota, which we call microbiome, which have been found out to have a collective community with activities that really promote homeostasis or balance in the ecosystem within the gastrointestinal tract. And this is the microbiome. So in this talk, I'll be talking about gut microbiome. Let me just abbreviate it as GM. Whenever this microbiome are healthy in a balanced state, when we talk about balanced state, the type of microbiome, the bacteria, the type of bacteria, meaning to say the phyla and the genuses, as well as that of the quantity or the density, they are healthy and balanced. Then that particular micro ecosystem is said to be in eubiosis. But if there is a disruption in that steady state, it's called dysbiosis. And this dysbiosis is really what disrupts the normal or the overall health or makes our health suboptimal. The gut microbiome has a lot of functions, one of which is really it's on nutrient metabolism. I'm pretty sure all of you are healthcare professionals when we were in our 1 hour lecture on nutrition, maraming sinabi, di ba? It's important for synthesis of vitamins like B1, thiamine, B2, riboflavin, B3, B1, B7, B6, B12. Pero puro ano lang yan, memorization lang yan. Tapos nandiyan yung vitamin K, and then there's the absorption of minerals, calcium, iron, etc. We never learn to appreciate it until we go deeper into what their roles are and how they interact with our health. But that's a very important part. We need all this GM for normal digestion, for normal nutrient metabolism, whether it's the production or production of those vitamins or the absorption of those minerals, etc. Another important importance of GM is actually the bile acid metabolism. I'm pretty sure you were exposed to that the main function of the bile is emulsification of fats, right? And emulsification of fats are supposed to transport the fats across the gut, no? The mucosa of the gut. That is true, but bile acid metabolism is beyond that. Bile acid metabolism, the derivatives from the bile acids have many other functions that are of importance to health. And I'll be discussing that later on what are those, what is that specific function of those bile acid derivatives. And of course, there is such thing as drug metabolism. Ang mga microorganisms are very sensitive to drugs, and they are also metabolizing drugs. Hindi lang yan sa liquid. And drugs can actually destroy the steady state in the GM. So xenobiotics and drugs, these are also metabolized by the gut microbiome. And another thing that we should also consider is regards the control or into the immune function. Very few people realize that the gastrointestinal tract has 3 main functions. One, we know from our basic sciences that it has an endocrine function. There is some production of hormones like gut peptides that are going on. But that's not the only one. There's another one, which is the neural mechanism. It is a second nervous system that we have. That's why we have the so-called enteral nervous system. And there is the third one, which is the immune system. So it has a specific function and role in maintaining our defense on infection and other autoimmune diseases. So these are 3 that we have to consider. So I was asking my friend in developmental biology about the significance of kasi kung naalala niyo sa embryology nung araw, nasa bachelor's pa tayo, di ba yung mga embryo, unang nag-develop ang nervous system, sumusunod na yung gut. And that gut is connected to the nervous system. It connects to the other parts of the body, extending from the one pole to another. So that's how important our gut system is, even at the start of life. So with those type of functions, because of those 3 functions attributed to the gastrointestinal tract, there's such thing as an axis between the gut and a specific organ. So there's such thing, and that axis, gut organ axis, is a question about communication. So there's always a communication going on in our body. So between the gut system, as you know, are made of the GI and the gut microbiome that is communicating with the brain, or it's communicating with the endocrine system, or it's communicating with the pancreas or the bone, etc. That's how central the gut is. And that's how important maintaining our health and helping our gut maintain an optimal health because of the central role it plays in optimal health. Anything that disrupts this axis can have certain manifestations that is the opposite of health. Notice here that in this illustration, there are many types of bacteria sa stomach, sa duodenum, jejunum, ileum, and the colon. They are normal populations going on or are residing in these different parts of the GI. And so these are our friends, no? Remember that the bacteria, so the viruses have been here for how many years? Billions of years. Ang human beings, hundreds of thousands of years, right? So it's more advanced, humans or the gut microbiome? Who has more adaptive mechanisms? Who is teaching who? Who is helping who? So that's the intrigue I want to leave you behind. Okay, so what shall we do knowing the importance of the gastrointestinal tract? Let us start helping our gut. What are the factors that positively impact gut health? Number one, the master of them all, sleep. How many of you last night have a good 7 to 8 hours of sleep? Raise your hands. Shame you, the rest, ayaw. That's number one. Because everything else follows, right? So, because with sleep, it allows us to recover. Hindi ka kumakain, hindi nakakapagpahinga ang GI system. Pagpahingayin nyo naman yung gut system, ang ating gut, no? So it allows recovery. And if there's recovery, if there's certain trauma in our gut because of whatever you ate or whatever you did, the normal microbiome population recovers. And if it recovers, it can do other functions, specifically the immune function. Another positive impact factor that positively impact the gut health is the physical activity, because regular exercise was found to promote the growth of a certain species of or genuses of or strain of bacteria like Bifidobacterium and Akkermansia. Nakakatantis, ano? Another thing is stress reduction. Now, stress reduces microbial diversity and alters gut profiles. So, importante yan. Okay? So, I made sure that in this presentation, I'm not stressed. That's why when Alex invited me to take over the gut health, I said, okay, I'll finish by Thursday. I don't like to get stressed. I don't like to upset my GM. That's why yesterday I was in Quiapo eating panghon, palabo, etc. before I go here. And I was praying that my gut will not be upset. Trimnut is not upset. So I'm relaxed, enjoying this stuff. And also, diet. Diet that will allow us, that is rich in probiotics and fibers as prebiotics. So, food rich in probiotics. Probiotics are nothing but these are bacteria that, when taken here, provide health promotion. Prebiotics, that's the scientific term for the fibers being consumed by this bacteria that provides optimal health for our guts. And also the diet, one of the most important metabolite that is produced in the metabolism and the GIT is the SCFA, which is the small chain fatty acids, the acetate, the propionate, and the butyrate. These are all very small fatty acids that are utilized by the body. Hindi pa masyadong na-discuss noon sa biochemistry natin nung araw. Kasi nung araw hindi pa masyadong alam. Ang alam lang nila mga linoleic acid, linoleic acid, all those acids. Yung pala, mas may mga central molecules that are important. And these are the SCFA. And we'll go there later. You know why? Okay. So what are the food high in probiotics? There's yogurt. One of my favorite is the black cherry yogurt, which is actually a live culture, lactobacillus and bifidobacteria. Then there's the fermented cabbage, kimchi. Who loves kimchi? Yes, I don't like it. Gusto ko yogurt, but gusto ko Japanese to Korean. Okay. And there's also kefir and there is miso. I love miso, actually. So these are food high in probiotics. Filipinos are so blessed to have lots of the usual food that we eat are very rich in prebiotics, no?
And then yung garlic, leeks, onion, cassava, sweet potato, bananas, apples, strawberry from La Trinidad, mung beans, oats, etc. So I love this food actually. Okay, my next question is, di ba ang gastrointestinal tract sa stomach palang napaka-acidic? So, as I told you, bacteria have been here for how long? Billions of years. You can find bacteria in the spring, in the hot spring, in the volcano, right? Very hot, very acidic. Do you think that they can survive the gastrointestinal tract like the stomach with a pH of 2? Kahit sila, kahit buhusan mo na sa uric acid yan? I think so, because studies have shown that probiotics survive the gastric pH. For example, the Lactobacillus rhamnosus GG and the Bifidobacterium animalis lactis are all highly, they thrive well in the different pH of the gastrointestinal tract. Okay, so let's have some studies about gut microbiome. So remember the gut organ axis that we're talking about. So let's have the gut microbiome and the GIT itself. Is there evidence about it? Actually, there are lots of evidence. I'll just discuss some of the studies that I said, okay, mukhang maganda i-discuss. But I'm telling you, there's so much studies about probiotics and probiotics. Cute ba sila? Cute, no? That's AI. I didn't put my face there. Okay, so this is AI generated. Okay, so there was a study that was done. The question, that study asking the question, does this bifidobacterium, does the supplementation of bifidobacterium provide clinically relevant benefit on defecation frequency and GI well-being? Ibig sabihin, gumaganda ba ang frequency ng pagdumi natin o ng mga pasyente, ang mga taong nabigyan nito? And these are healthy subjects. The design is randomized controlled trial. It's double-blind, placebo-controlled, and sample size is okay. So I said, I'll try to discuss this kasi baka nakapasa ang evidence level. So what was shown here? What is shown here is a study here that showed you the change in defecation frequency, how many days per week. Now there is the bowel movement as a function of time, and you notice that the lowest is the lowest graph there, line that is the control. Well, the second and the third top line are 1 billion CFU of the bacteria. And they found out that there's indeed a significant difference from the control. And at the same time, you notice the trend that the bowel movement is increasing. But it's not increasing in a way you can classify it as diarrhea. In a more technical way, if you notice on top, on everything here, that the medium or the measurement called the odds ratio, the odds of having that measurement of defecation proved to be in favor of probiotics. Meaning to say, if the odds ratio is 1.5, means that the patients or people who help individuals that are taking probiotics are nearly 1.5 to 2 times the chances of improving their bowel movement. And it is true whether it's taking 1 billion or 10 billion CFU units of the bacteria. Okay, now there's an interesting, one of the most studied gut problem with regards to digestive health is really the IBS or the irritable bowel syndrome and the inflammatory bowel disease. Irritable bowel syndrome, that both of this is actually a spectra, no? They have both abdominal pain, cramping, changes in bowel movements, such as diarrhea, constipation, alternating. Ang laking problema nito. And then I just talked to certain friends in the GI that say it's really quite prevalent ang IBS and IBD here in the Philippines. So IBS, irritable bowel syndrome, that's characterized with bloating and gas in addition to the pain, cramps, and changes in bowel movement. IBD, on the other hand, meron siyang bloody stool, fatigue, reduced appetite. So naapektuhan na ang kabuuan ng pagkatao niya, ng health niya. And there, here shown here are all the treatment modalities. Now, for IBS, dietary changes, antibiotics na naman, exercise, mental health therapy, etc. So how about an intervention that is quite about the bacterial population itself? Okay, this is a study that was done in 2020. This is a case control study. In a case control study, there's a group of individuals, the cases. Ibig sabihin may IBS sila. And then there's another group that do not have, meaning to say healthy. But they are matched, meaning to say they're almost the same, except that yung isa may IBS, yung isa wala. The red ones are the cases and blue ones are the control. What do you notice? And what is shown here, on the numerator, is the central log ratio, meaning to say that's the density and population of the flora, the bacterial flora, and on the y-axis, those are the different species. So you notice that there is a difference in their distribution. Nakakaiba ang blue ang mga cases of IBS sa control, right? They have specific, there are changes in the density of the different genera of the bacteria. So what does it tell you? Notice that there were 19 species significantly associated with IBS. So they say that people with IBS, most of them really have a problem with regards to the distribution and density of the microbial population at the gut. Maaring yung mga iba, there are things like opportunistic bacteria that, medyo dumadami, so causing some destruction in the GIT. Okay? So that's what is established by this study. Indeed, there's a problem on the density and distribution of the bacteria in the gastrointestinal tract of patients with IBS. So ibig sabihin, kapag nagda-diarrhea pagkakain, isipin na lang siguro nakakaroon ng problema aking GI. At ako'y nagda-diarrhea. All the stuff that are bloating, etc. Now, that study further computed the pairwise odds ratio. Ibig sabihin, from that previous slide, they measured the odds of having, sa mga iba't ibang mga bacteria na kita, what's the chances, which of them has the highest degree of chance of being abnormal in their distribution and density. So yung mga pula, yung more than one, these are the bacteria that are quite problematic. Medyo may problema sila dun sa mga na-analyze na fecal sample. Na ibig sabihin, ito ba yung mga normal part ng gut microbiome, and they had some problems in density and distribution that cause the different symptoms of IBS. Yes, there are. Interesting, there is Lactobacillus there, Stradivarius, and Lactobacillus ginsenians that aren't a normal part of the gut microbiome. So what is being manifested here is probably the fecal sample that they got, these patients with IBS are actually taking probiotics to treat their IBS, kaya siya mataas. Then there is Clostridium perfringens. Oh my God, Clostridium perfringens is it's part of the normal gut. But you see, if there is alteration in its density, that really causes antibiotic-induced diarrhea. And there's something interesting, no, girls? Gardnerella vaginalis. Sabi, paano punta tong bacteria sa vagina at napunta sa colon? Right? Sabi, ano kaya to? So they found out that that stool probably has been contaminated during the collection process. But 80% of these patients with contamination turned out to have IBS. So this just strengthens the so-called gut organ axis that is going on when health is at optimum due to the altered gut state. Okay? So ang sinasabi lang itong study na to, indeed, there's really a problem on the gut microbiome, homeostasis, on IBS and IBD. And that's why probiotics are one of the most important interventions to promote gut health. Now, there's something interesting, you know. So I look around, I said, okay, probably walang sa Philippines, so let's go to Canada, where I stayed for 13 years in Canada. So sabi ko, meron kaya ang Canada na, sites for us? Because Canada is very strict on, Canada is a one-payer system. So wala kami doon bayad pag kami na-ospital. So okay lang yun. So, but because it's the government that pays when somebody is sick, the government is very strict on promoting and preventing diseases kasi magastos, right? So everything that can help promote and prevent disease, ginagawa yan at sinusuportahan ng gobyerno. True enough, I found a website by a group, an independent group, AE Probio, whose role is to show to the public, to provide clinical guides to probiotic products available in Canada. So ang sarap niya mag-research, no? So the purpose of this is to provide guidance to consumers. Yung mga bumibili sa supermarket, or we only have two drugstores in Canada, the Rexall and the Shoppers. Kaya boring mag-shopping sa Canada, dalawa lang. But these are available commercially. So they try to, and there is an independent group, no, scientists, epidemiologists, clinicians that independently assess the evidence behind the registration of the product. And there are 3 levels, 1, 2, 3. 1 has the highest level of evidence, so probably that's a randomized controlled trial. And the level number 2 is probably from observational study. And the lowest evidence probably the just patient experienced by a certain physician or whoever. And so, if you, I tried to click adult health. So you notice there that there is the brand name like Activa. I take this is very delicious. And then the probiotic strain is the Bifidobacterium animalis. And what is the application? For constipation and irritable bowel syndrome that is recommended. But this form is in a fermented milk. I don't like this because lactose intolerance, pero masarap eh. Kinakain. I take it. And then the CFE is 1 billion per serving, and it's taken 1 to 3 servings. And I said, what's the evidence behind these applications? No? And true enough, if you click the positive there, it shows you the evidence, the references. And in Canada, you can go to the library and look for these references and read about it. So it's a very nice thing here in this website, just to show you there's a lot of study already in probiotics and gut health. And you can always go to this website if you think there's certain probiotics available in the Philippines that we can look up and see and be guided on what we should be using. And this is useful not only for the consumers, but also the family physicians. Kasi usually sa Canada, nauunang tumiting sa pasyente, family physician. Okay, so that's it for the gut health, well established. How about other parts of the health? Okay, how about mental health? Cute nila, no? AI na naman yan, mga kapatid. Okay. So, AI health, mental health. So it's about, there's the gut-brain axis is very important for a lot of mental health and neurologic disorders that are going on. In fact, a dysbiosis can result to depression, anxiety, or can be associated rather. I have to be more technical in this. Any form of gut-brain axis or gut dysbiosis are strongly associated with depression, anxiety, bipolarity, etc., as shown in this slide. And let me just run through what those studies, what the results of those studies are. For example, in a cross-sectional study of seven, this is a review of certain studies here, the cross-sectional study of 76 individuals, 40 of which has a generalized anxiety disorder. The associated symptoms are lack of appetite, abdominal discomfort, GI tract, so that's the GI problem, and the CNS manifestation, irritability, sleep problem, muscle tension, concentration, etc. And they found out that there are decrease in the density of these certain types of bacteria. The same way for the cohort, there are even more types of bacteria that are undergoing changes in their density and distribution. And there are also other findings that they found out. For example, humans with major depressive disorder have fewer bacteroides and all this bifidictorium and lactobacillus in species in the gut. Ito yung mga major depressive gut. Pero huwag niyo naman sabihin sa kasamahan niyo pag nadi-depress, ay baka bumaba ang gut bacteria. No, it doesn't work that way. Okay? It's just a study that showed that among those patients. Also, antibiotic use are associated with development of MDD, major depressive disorder. So don't tell your friends na, oy, huwag mo i-take yan, baka mag-depress ka dahil ang gut mo. No, that's not the way. It's just an association of these signs and symptoms with that of the changes in the bacteria. Also, psychological, those with stress, there's increased permeability of pathogenic bacteria, and so on. So ang dami niya. Ang dami talaga association. So ganun ka-importante ngayon talaga ang gut health. So you are in a very good position to be taking all those supplements because you are really promoting your gut health. Okay. Hindi pa ako tapos. Huwag niyo muna ako pansin. Okay. Lampas na ba ako? 2 minutes. And also there are on metabolic health. In metabolic health, ganun din, ito yung mechanism, biochemical mechanism on how the gut health influences carbohydrate metabolism. Okay? I don't have much time on this, but we can always discuss it privately and how this happens. You can lecture this in your classes on the relationship of gut metabolism, of gut health, and how the microbiome function and glucose metabolism. And studies show, a study with lactobacillus rhamnosus GD showed that glycated hemoglobin is stabilized, meaning to say in 3 months with intake of probiotic compared to those groups that are not taking it. And these are usually happening among elders, and not so young rather, to the young ones, to the ONCE. Okay, to the young ones, not so old, not so young. And there's a maintenance of glycated hemoglobin among these individuals that take lactobacillus rhamnosus GD. Also, there's an evidence on the benefit of probiotics among diabetic patients based on systematic review and meta-analysis. Very strong evidence. Okay? So with this, also among children, lactobacillus, there is a study that showed systematic review and meta-analysis of the health benefits of lactobacillus and bifidobacterium animalis in children. And they have certain explanation like um, they prevent the diarrhea in the gastrointestinal tract. It improves or normalizes the gut microbiota, and also the dental caries, as well as all those prevention of the fungal infection going on in the body. So indeed, this probiotic supplementation promotes or optimizes gut health. So let's have some supplementation and beware of taking all those antibiotics and all those processed food because they're not really good. Ang pagkain ba natin dyan processed? Kasi they will alter our gut microbiome. So let's embrace a happy, healthy gut with a healthy lifestyle. Thank you.
Thank you, Dr. Tanael. Before we proceed to our next segment, we will announce the 3 winners of our early bird raffle. May we call on stage Ms. Joyce Ramaliosa to award our winners. Here they are. Brain Guyvern Aguila. Next, Teresa Preciosa Cuerpo de Matera. Congratulations. The last winner, Lyrel Ann Aranas. Congratulations! Our journey towards optimal health continues with a topic that spans the ages. We are about to explore nutrition through the ages, a comprehensive guide to nourishing our bodies at every stage of life. From infancy to old age, the nutritional needs of our bodies evolve, and understanding these changes is key to maintaining our health and vitality. And who better to guide us through this journey than our next speaker, an expert in the field of nutrition and wellness. So let's give a warm welcome to our speaker as she takes on a comprehensive exploration of nutrition through the ages. Please welcome Miss Mary Rose Del Rio. All right, great morning, everyone. Can you please tell to the person beside you and say, we are on a mission. All right, so I'm feeling a great energy from our crowd. You know, this topic that was assigned to me is actually a very memorable one. Why? Because when I actually learned about this topic, this gave me curiosity and a lot of realizations. What if my mom and her healthcare provider would have been more nutritionally oriented? Would I have been more taller? Would I have been smarter? Or probably I will have a stronger immune system and I can prevent the recurrence of my allergic rhinitis, which I just overcame 4 years ago when I knew about this. So are you excited to know more how to optimize your health? Yes, definitely. So yes, I've been I love this quote. I've been actually showing it to a lot of people, right? Because we know that health is the foundation of everything. Yes. So as healthcare professionals, we have to be this instrument. We can be this instrument why this person has achieved so much in life, right? So technically, a baby, for example, has grown so much because a health professional like you was able to advise the mom to take this list of nutrients. And this healthy baby eventually becomes a healthy adolescent, right? And then becomes the top of its class, eventually becomes a healthy and a very top class doctor. So whether these dreams will flourish or not, it depends primarily not just on the individual, but more so to us, healthcare providers, right? That's why we have this great mission to empower every household of these optimal nutrients. So what are the challenges that we are facing these days? We have what you call the three phases of malnutrition. So this data is pertaining to global, all right? So when we say stunting, there are children under 5 who are too short for their age, wasting, they're too thin for their age, and of course, overweight. We've known about that, right? And here in the Philippines, according to UNICEF, there is an estimated $4.5 billion per year future economic loss if this malnutrition will continue to persist. So imagine the funds that may just go down the drain just because of this challenge that we can actually address. So on the national level, what we have been doing is that we have what we call the Philippine Plan of Action for Nutrition. So this is the country's blueprint for nutritional improvement. That is actually I was actually surprised when this topic was given to me and I reviewed about this. One of the strategies of the Philippine Plan of Action for Nutrition is the life stages, being very nutrition specific. So I believe that our movement in here is also aligned with on the national movement, right? There. So life stages approach, this will further equip us, health professionals, so that we can properly guide every guardian of every household so that they can empower every member of their family regardless of age. And also we are aligned with Sustainable Development Goals, which is by 2030, we are looking forward to end all forms of malnutrition. So that includes stunting, wasting, 3 phases of malnutrition you have seen earlier, and at the same time addressing the nutritional needs of the adolescents, and most especially what we call the vulnerable groups of our society that includes the pregnant and the lactating. All right. So we have what we call the first 1,000 days of life. Who is the first time who heard this? Anyone? First time heard the first 1,000 days of life? Okay, not much. All right. So first 1,000 days of life, this is a very crucial and important part. Okay, why? Because, and this is sometimes a neglected part also, especially for those women who would like to conceive. Okay, so why is this a very crucial? Because it has a short-term and long-term impact, not just for the parents, but most especially for the child, right? As it grows, it will impact the whole family. So that's why it's very important at this point we really give full attention because we have to break this cycle, right? It's part of our mission. Okay, regardless of whatever stage you are in your family, I believe one of the reasons that you're here, right? You have a purpose, and whatever information that you'll be hearing in here will definitely create, you know, an impact to your fellow family members and to your patients and clients as well. So as you can see here, for children who are in low birth weight, meaning they're weighing less than 2,500 grams, they have increased risk of mortality, frequent infections, and impaired cognitive development. That's why you would notice you would hear some babies, they are sickly. There are some babies who are, you know, just healthy enough, right? And then as this continues, a stunted child can have increased risk of learning difficulties. Can you remember when you were probably a kid? You tend to compare your exams, right? From one classmate to another. Why is it that for some kids, even though they have been, you know, staying up late, working so many hours in school, but still the grades are not so good. Whereas you have a classmate who didn't even stay up late, and yet he got the highest grades. So I had an experience of that, right? So I can clearly remember, why is this happening? I thought it's about the genes, but over time, I realized that, oh, there can be modifiable factors, right? And part of it is the nutrition. So knowing about that, it means that we are in control. Can you say that to the person beside you? We are in control. Yeah, so that's great news, right? That we are in control. So let's not blame our genes or our mother and father side. Why do we look like that? Why do we behave like that? Right? Because nutrients can definitely create an impact regardless of whatever stage you are in. And then, of course, as this continues, an adolescent can have further challenges in nutritional health and their health. And moving forward, of course, for women, it can have a maternal health problems. All right. So probably have also observed that there are some babies that can already speak at around 1 year old. Have four parents here. Can I see a show of hands? Yes. Right. So probably you might be hearing your babies, they're trying to speak at around 1 year old. Well, some parents are having a hard time hearing the first word, the mama and the daddy or the dada, right? So one of the contributory factors is that if the child is too short for their age, meaning they are stunted, the temporal lobe is greatly affected, which is responsible for the auditory object recognition, comprehension, memorizing. So that's how crucial this stage is, right? And it will definitely, really affect, it will create a huge suffering, not just for the kid, but more so to the whole family. And we don't want that. It has long-term, short-term, and long-term consequences in terms of our economic productivity, right? So definitely the kid will continue to carry that as it grows. So we have to break the cycle. So what can we do? First is definitely prevention. That includes prenatal care, immunization, right? There is also growth monitoring, health education, and of course, the power of supplementation. Because at the end of the day, that really gives you a peace of mind. But what if the client or the child in front of you, the mother is already like, oh, what if my baby is already stunted? What can we do? Studies have shown that, well, we have known omega-3 fatty acid as a brain nutrient, right? We have been hearing about that. But this recent study has shown that omega-3 fatty acids has been also very important and contributory in terms of increasing height. Who among of you guys have kids here who are less than 5 years old? Yes, I am seeing some hands, less than 5. So probably at this point, you might wanna, take a look or probably observe the growth development of your kids and your patients as well. So I'm actually kind of, regretful if this was, given to me when I was younger, I could have probably grown taller, right? So especially for some others would actually say, well, Filipinos are actually more so of that height, but no, studies have shown that we can definitely influence our growth, especially if we are given optimal levels of nutrition. By the way, there is what we call the Philippine Dietary Reference Intake. So on the next slide, I will not bombard you with so many numbers because I'm sure we would not even memorize it. In nutrition, we have what we call the Philippine Dietary Reference Intake. This is published by the FNRI, the OSC. This is based on the regular National Nutrition Survey being conducted here in the Philippines. And this is personalized for Filipinos. So if you're wondering, why is it that in the bottle of supplements, what is the basis of all those nutrition facts, right? So especially I would like to commend USANA because one of their values is personalized nutrition. So the products that are available here in the Philippines are customized for the Filipinos, and the one that is being shipped in other countries are for the nationalities or for the citizens of that country, appropriate for their nutritional needs. So here in the Philippines, as you can see, it is very comprehensive, right? Me, even myself, I cannot memorize it. But just so you know, there are a lot of vitamins, and this one are the vitamins. The next slide are the minerals per age group, per gender, and depending if the person is pregnant or lactating, the nutrients vary. That's why this slide actually gives us, the thinking na, oh, so vitamin C is not enough, right? Having B vitamins alone is not enough, because I've been hearing some people that, oh, I'm really good, I'm just taking B vitamins and I'm okay. Oh, I'm really good at taking vitamin C. So it's not actually these companies who's telling you to buy, but it's yourself who's actually demanding all of these nutrients for you to function at your optimal best, right? So whatever profession or business you're in, at the end of the day, you want optimal results from your work, right? So you would want to put in these numbers into your body, right? If you know the numbers in your bank account, we have to know the numbers that we have to put into our body. Agree? Yes, right. So of course, we don't need to memorize all of these. That's where, the diversity of food will come in, plus the leverage in supplementation. So let's be more specific. During the pregnancy, here are the B vitamins that are very important. Oops, sorry. All right. So folate, which is very crucial, especially in the early pregnancy, okay, for DNA synthesis and neurotransmitter production. So it is very important for the formation of the neural tube development that is responsible for the brain and spinal cord, right? So you would want to lower the risk of your baby having that spina bifida and anencephaly. You don't want that. Another B vitamin that is equally important, which is responsible for the digestive formation of the digestive system and converting food into energy, is your niacin, or the vitamin B3. Whereas a deficiency in cobalamin is actually attributed to having preterm birth. So if you would actually check in your genes, you might have sister or siblings who doesn't have full-term babies. You don't want to miss out this vitamin, because this is highly responsible for having a full-term baby. We don't want preterm births. Okay, so moving forward, vitamin A and vitamin D, these are your fat-soluble vitamins, right? Actually, if the mother would regularly take dairy products, eggs, you can regularly get these nutrients in addition to supplementation. Vitamin A is very important for the baby's eyesight. Okay, so there are babies who are born with very poor eyesight. They need to have eyeglasses. I know some mothers who are like that, who have been suffering from those kind of nutritional deficiencies of their babies. Also, vitamin D, of course, we know that it's also equally important for the bones, right? So same with the calcium. They go hand in hand together with magnesium. Choline, which is also responsible for the brain health, all right? So iron. Iron, these are your minerals, okay? So it's very important, especially for hemoglobin production. During pregnancy, the blood volume expands to support the growth of the baby and as well as the placenta. So you would need that. Magnesium, almost similar benefit of the B12. It is also important for having a full-term delivery. Calcium, of course, it goes hand in hand with your vitamin D at the same time, not just for your bones, by the way, but also for your heart, muscle, and nerve function, your calcium. Okay, zinc and iodine, moving forward with our minerals. I don't know why is it like that, but anyway, minerals, you have your zinc that is also very important for your early pregnancy. It is important in terms of supporting the baby's immune system, whereas your iodine is responsible for thyroid hormone production. A deficiency in iodine, by the way, can create some mental health issues. So you don't also want to miss that out. And DHA, your omega-3 fatty acids, well, your body cannot produce it. That's why the mother has to be very intentional in taking this from fatty fish and omega-3 supplementation. Because ideally, you would need around more than 1,000 milligrams of that or even higher. And it's really challenging to quantify from eating salmon and tuna if you have achieved that much, right? So that's where your supplementation can come in, especially if the mom is, very busy working mom. All right, now that the baby is born, what does it need? We have this Executive Order 51, the Milk Code in the Philippines, which promotes exclusive breastfeeding, okay, during the first 6 months, okay? And then 7 months onwards, there is what we call the complementary feeding, wherein you get to introduce solid food. But however, yes, there are nutrients present in the breast milk, but there are some nutrients which are in highest concentration during the first few weeks, and then it gradually declines. However, for the protein, it's in highest concentration during the first 2 to 6 months, and then it gradually declines on the 7th month. So that's where the complementary feeding can be supported. That's the time that you would give your baby with the meat, dairy, the legumes, so that can be an additional protein source to further the growth and development of the baby. Also, we have the vitamin A and E. This is something that is in highest concentration in colostrum, right? The first milk that is produced after giving, by the time that the lactation has just started, and then it stabilizes over time. Whereas the calcium, the zinc, the C, and the vitamin B, it's in highest concentration during the first few weeks, and then it gradually declines over time. That's why the mother has to be also very intentional in continuing to eat a lot of fruits, vegetables, and grains, and of course, a quality prenatal. And but at that time, a multivitamin, quality multivitamin, would be sufficient enough to provide those. Okay. Moving forward, okay, the toddler. As for the toddlers, this is the time when, who has toddlers here? Anyone? 1 to 3. Oh, we have toddlers. Moms have toddlers. So I believe you have been noticing some eating patterns, right? Changes in food behavior, such as selective eating, food neophobia. What is that? Food neophobia, where the baby is resistant in trying some food because of unfamiliar taste and texture. There is also what we call the food jab. Sometimes they like it, sometimes they don't. Today is their favorite, today they don't like it anymore. So it's normal. And the guardian, the parent, and the doctor especially, I believe we have pediatricians in here. Can I show hands? Can I see some hands for the pediatricians? Hello. So I believe that these moms who have toddlers, who have infants, can really work hand in hand with you. So yes, we have to understand that yes, it's normal for the babies to have like that. So would I be carried away if my baby doesn't really like this fruits or vegetables? Or would you be this parent who will just give this hot dog to Sino or like the nuggets because they like it, because it's the only thing that they're eating? You can actually think at the moment that you're giving a solution, but you're actually having a long-term problem for you and the baby, right? So we don't want that happening, okay? That's why, well, with those challenges in terms of eating patterns, we all want these multivitamins present. So that's where, creative cookery will come in, because eventually if this eating pattern or food behaviors will continue to persist, we would have challenges in terms of lacking in sufficient nutrients that will eventually impair their growth and development. All right, and then as the children grows, as the children grows by the childhood, this is the time when the children is around what, 4 years old above. So they already enter school. So they enter the world of the influence of their peers. So this time, it's not just you who's influencing their food intake, but much more their classmates as well. As they enter the room, break time, they get to see a classmate eating donut, eating what? Chips, drinking soda. Welcome to the world of pro-inflammatory food. So that's where your omega-3s will come in. That's where your supplementation will come in. Because as much as you want to be 100% control for your kid, the truth is you cannot. That's why we really have to leverage on quality supplementation, but not just your regular supplements. Supplements that's really well studied, that contains all the nutrients, what the organs of your kids demand. right? So what I'm actually very impressed about USANA, more than 150 scientists have studied all of these. If these nutrients are something that by this age, are in terms of the daily requirement and at the same time in terms of the safety, in terms of the manufacturing. So how to give these animals for ages 2 to 4 years old, you can give around 1 tablet for 5 years old above, around 4 above. So 3 months, 3 years old and 3 years old and 9 months rather, the 1 tab, and then 4 years old above, you can start giving the 2 tablets already. Okay, and now the adolescent period. So this period is actually marked by physical growth, reproductive maturation, and cognitive transformation. This also brings a lot of memories, right? During elementary, high school, when you're lining up, why is it that some classmates, even though you're almost at the same age, some are taller than you and you're just sometimes in the middle, I'm always in front. Okay, so this actually when I realized, oh, it's not my fault, right? So there are actually nutrients that could have been contributed to my physical growth if it was given at an early onset, right? And also reproductive maturation. You will notice some women having early menstruation. Some, they have late menstruation. Well, these days we're having what they call the PCOS, right? Polycystic ovarian syndrome. Okay, some people are having irregular period. So there are nutrients also that are responsible for that. Okay, and of course, cognitive transformation. Hello to the cum laudes, to the Latin honors in the house, right? And also to the achievers and the wannabes. So regardless of, we can still improve our cognitive development regardless of age. Is that a great news? We'll learn more about that later when you see the adults portion. Are you excited? So even though you probably think, oh, I really have bad grades back then in school, but your past doesn't define you, right? So let's start today, moving forward. We can have really, a great future as we acknowledge that yes, we can achieve having optimal health. So let's moving forward to the adults. All right. So we are facing here a lot of micronutrient deficiencies that can impact the different parts of our body, and you don't want that. Sometimes probably you can take a look at yourself in the mirror and just observe how are we growing so far physically, right? So what have we been observing in terms of your eyes? Is that dark circles appearing? Teeth and gums. If you brush your teeth, you easily is there bleeding right away, etc. So there are signs and symptoms which can actually show if you are deficient on a particular nutrient. And these days we have the saying that a lot of people are overfed, but they are actually undernourished. So these are the nutritional challenges that adolescents and adults face. Why? Because we are, starting with letter B, always busy, right? So when we are busy, adolescents are busy in school, so they just tend to what? Eat in fast food, okay? Have their baon, but their baon is what? Processed food, okay? Nuggets, etc. Okay? And also, a lot of us have gadgets. So there's always an exposure to blue light. With a lot of lights coming into our eyes, it's only the high energy blue light that can reach the macula, which over time can contribute to poor eyesight. But studies have shown, which you can also see later, that lutein and zeaxanthin acts like a blue light filter so that your eyes wouldn't fully absorb all those blue light coming into your eyes. Also, all right, who are fans here of coffee shops? Starbucks, coffee, okay, that's free advertisement, right? Coffee shop fanatics. Okay, so did you know that when you always drink coffee or drink soda and at the same time alcohol, it can deplete your magnesium levels? So let's review what is the magnesium for? Your magnesium is responsible for your muscle and nerve function, your blood sugar levels, blood pressure, and at the same time your bone and DNA. It does a lot, right? And you don't want those parts to be affected, and you always want your magnesium to be at very good levels. So apart from consuming all of these sources, Okay, we have this product, it's called Magnically, which you can also see later. All right, so this data, we don't want to be a victim of this, aren't we? Because there is this data which shows that by 2030, very Saturday, 80% of death in the Philippines will be caused by not COVID, but non-communicable diseases. You know, the usual thing. And micronutrient deficiencies has a large contribution in terms of decreasing that, or making those numbers irrelevant over time. Are we in it to win it? We don't want to be part of this 80%, right? Especially our family members. So we definitely need to be proactive. Can you tell that to the person beside you? Let's be proactive. Yes. So let's be proactive because we can definitely save lives as we, go together. Okay, so for the adults, as you can see from head to toe, yes, we need a lot, right? And it's very challenging to really quantify if the banana, the apple I ate in the afternoon, or the chop suey I ate during the dinner, what amount of vitamins or minerals can these give me? So basically, that's where your supplementation would come in, thanks to Silk Essentials, right? That's one of my regrets. I hope I knew Silk Essentials when I was younger. I could have had stronger immune system, better metabolism. Even the times I see the people in here when Dr. Eve asked if who among you guys had more than 7 hours of sleep. And I assume since majority are health professionals, can barely have that 7 to 8 hours of quality sleep. But this Silk Essentials can actually give you that, quality, restful sleep, even though you sometimes just sleep for a few hours, but you really give this Dharna energy for the whole day. You want that. So you would want to have that Silk Essentials at optimal doses, okay? But aside from it's a combination of multivitamins, however, it has what we call the intelligent technology, which promotes the cell communication. So you would want your cells to be always intelligent enough. It knows what to do, especially during the times you eat, a bite of hamburger or you stay up late. You always want your body to keep on fighting for you. So these are the physiological changes of the adults and elderly. Number one, of course, is cognitive impairment, which is characterized by high inflammation due to the high consumption of fatty food, fast food, sugars, etc., and low BDNF. It's a brain-derived neurotrophic factor, which is responsible for the learning, mood, and the focus. Okay, so you would probably notice yourself or, the elderly. Oh, sometimes they're lagging. Oh, what again? Okay. So things like that, right? You would need certain nutrients to keep those cells up and running. Of course, for eyesight, we have what they call the age-related macular degeneration. But according to this study from nutritional neuroscience, those who take this combination of bacopa, American ginseng, and coffee fruit extract experience increase in mental efficiency, significantly improved accuracy, and response time during cognitively demanding tasks. Even you're very busy, you can still think properly. So it's not really an excuse. Oh, I'm sorry, I didn't perform well because, I'm fed up with a lot of things. Thanks to Copan, I just actually took today. And that's one of my staples in USANA. So what's the rationale behind? Why is it that study concluded? It's because the Bacopa monnieri, as you can see, increases the BDNF. And okay, from the time you take it, when can I experience the effect? Great news, in as little as 1 to 2 hours after taking it. And the maximum impact will happen in 6 to 12 weeks time. All right, so you can see here, maximum impact between 6 to 12 weeks. So it's a great news for us, right? So we need those brains to keep on working for us, but we need to support its function for it to deliver its best. Okay. Also, lastly, we have omega-3 for your brain. So, well, we have been seeing a lot of studies about omega-3 that it supports brain health, but just so you know, an affirmation that yes, because it also supports the blood flow and the overall health of the brain, right? Okay, so as for the vision, so this is the study that I have seen in terms of the association of lutein and zeaxanthin in terms of, take note, preventing macular degeneration, and what if you already have it? So it can reduce the progression of late-stage macular degeneration, right? So definitely you can get that protein and CSNP from a lot of fruits and vegetables out there, but for the peace of mind, you might want to have it also from Visionex, okay, to be taken every night together. It has also bilberry extract and vitamin C. Moreover, for our bone health, it decreases, the bone mass decreases as we age, so we don't want to be a victim of osteoporosis. Who wants to travel a lot here? May I see a show of hands? Yes, we have a lot of travel goals this year, so you need strength. You need strength and flexibility, mobility, thanks to Magical D for that magnesium, calcium, and vitamin D. Also, it has silicon and boron, which locks in those nutrients, right? Because especially for postmenopausal women, as your estrogen declines, the bone density, the loss of the calcium in your bone, it really has a great loss. So for the joints, it can help the Procosa. This is a combination of the glucosamine, a vegetarian version, by the way. So for those who are allergic in seafood, this is a big help. And recent studies have shown that the combination of glucosamine and Meriva is much more effective than the combination of glucosamine and chondroitin sulfate. Plus, what makes Procosa different from the other joint supplement is the combination also. It has the addition of your vitamin C, magnesium, manganese, and potassium, right? So, and lastly, CoQ10, which depletes as we age. There are three factors why our CoQ10 depletes. It's present in the mitochondria, the powerhouse of the cell. So you might want that to be always present. Number one, aging, which is inevitable. Two is taking statin drugs, which is a cholesterol lowering drugs. One of the side effects is it decreases your CoQ10. Third is if the person is diabetic. That's why probably you would notice some elderly, they're at 70, they're at 80, even though they have been, eating breakfast, lunch, dinner, and they have complete sleep. They really are very slow in everything because we have to empower them with what? CoQ10. So in USANA, we have what we call the CoQ 30. So I want to end with this. I would like to acknowledge Dr. Myron Wentz, a world-renowned scientist, microbiologist, and Albert Einstein awardee. Do you know that there are only two Albert Einstein awardees in the world? The first one is who created the flu vaccine, and the second one is him. So why not know his works, right? And also, he founded the Sanofi Medical Institute. He said, with the right combination of all the nutrients essential for life, I could maintain healthy cells in a healthy state. I can maintain human cells in a healthy state almost indefinitely without any signs of degeneration. Do you want that for yourself? Can I hear an applause? Yes, we all want that. So fellow health professionals and health advocates, I challenge you and encourage you to make optimal nutrition not just a choice, but a prescription towards a better health for a better quality of life. Thank you.
Thank you very much, Ms. Mary Rose Del Rio, for the very informative segment. Now, before we continue with our next speaker, we will be having a 15-minute break. So please feel free to go there right at the back because we prepared breakfast for everybody. Breakfast snack for everyone. So the Healthy Potion will be right back. Thank you very much.
I was anticipating you might go out shopping. And I'm so glad that you're all here today. Thank you so much for coming back. And I'm also I'm glad that Mary Rose spoke ahead of me because that will cut down my talk by almost half. So that Dr. Maddela can speak before the jet lag kicks in. All right. Disclaimer. Now, the reason why I got so interested in nutrition is two personal reasons. 5 years ago, I found myself on the operating table about to undergo a heart bypass. At the time, I was 20 kilograms overweight. I was hypertensive. I was diabetic with 4 drugs, and the blood sugar still remained controlled. So obese, hypertensive, diabetic. Yung sinasabi ni Mary Rose kanina na 70% of the Filipinos die of, right? Kulang na lang cancer. Pero sabi nila, you die out of your specialty. Wag naman sana. Wag naman sana. But anyway, also the reason why I got interested in nutrition is because every patient who walks into the clinic always asks this question. Anong bawal kainin? Or, Doc, ano bang pwede kong kainin? Because my doctor tells me, you can eat anything. Walang bawal. Huh? You cannot go back to the same eating pattern that brought you into this disease in the first place. Or, the doctors can be very strict. Bawal lahat, bawal si ganyan, no? Wala nang makain yung pasyente, they die of starvation instead. So that got me interested in this topic. Now, I hope that at the end of my talk, we'll be able to answer these 3 things. No? Understand what is the common mechanism among the 3 or 4 diseases that Mary Rose mentioned earlier as the one causing death mostly, and how can we lower our risk of death from these diseases. Now, according to WHO in 2020, about 29 million died from cardiovascular disease, cancer, and diabetes. That amounts to about 55 people dying every minute prematurely. Because Philippines was colonized by Western colonizers, we followed their lifestyle of the West. And not surprisingly, we also have all these diseases that are prevalent in the West. Ischemic heart disease, stroke, cancer, and diabetes. Yan pa rin ang common sa mga Pilipino. Now, if you look at this, ischemic heart disease, stroke, cancer, and diabetes, they look like they are different diseases. But if you look closely, actually, they have a common thread. They are all chronic degenerative diseases. It's lifestyle related. Yeah? And they have a common underlying mechanism. And I'm going to explain it to you. Like, for example, cancer. People say, wala naman sa pamilya namin yung may cancer. Bakit ako nagkaroon ng ganito? Because actually only 5 to 10% of cancers are really genetically linked. 90% to 95% are actually lifestyle. The good thing about that is because if it's lifestyle, then you can do something about it, right? Even if you have those genes that your parents passed on to you that predispose you to cancer, by altering your lifestyle, you can actually shut off those genes that would have led to you developing cancer because of the science of epigenetics. No? The factors can still be modified. Okay, so what are the common mechanisms? No? The first one is inflammation. The second one is oxidative stress. And the third one is obesity. Of course, there are other common mechanisms, but I would like to focus on these three. And I'd like to start with inflammation. Now, when you scrape your knees because you fell, the experience of acute inflammation is familiar to you, right? There is pain, there is swelling, there is heat, and this is good. This is the body's way of protecting you from invaders, from bacteria, etc. But that inflammation can go haywire. When your immune system fails to revert to normal, usually acute inflammation should resolve within 1 week. No? Yung ubusin po natin, dapat after 1 week tapos na yan. But in some instances, even if the offending bacteria or whatever it is that caused it is no longer there, the body is still responding as if the intruder is still there. You go into chronic inflammation, which isn't supposed to happen. Or when your immune system rebels against the environment, sobra siyang hyperactive. No? It reacts to small things. How many of you here have asthma or allergy? Yeah, I have as well. No? Sometimes when your immune system attacks your own body, imagine your armed forces, who is supposed to protect you, is attacking the civilians. No? We call those autoimmune disorders like lupus, psoriasis, and even type 1 diabetes, when the immune system attacks the pancreas that produces the insulin. Kaya wala kayong insulin. No? And lastly, when your immune system causes inflammation because of your lifestyle and aging. Now, according to a publication from Harvard, yung chronic low-grade systemic inflammation, wala kayong mararamdaman. You don't feel anything. It's insidious. It's as if your immune system is on a heightened alert all the time. Para naghahanda sa gyera na wala naman. It causes so much changes inside your body. And it is said that it is the underlying cause of chronic diseases like diabetes, heart disease, and cancer. Okay? Guys, hindi nyo nararamdaman yan. Yeah? Maybe the doctor, if they request for certain inflammatory markers in the blood, like ASR or CRP, they will know that you are actually inflamed inside. Huh? Now, it is said that 20% of cancers begin as a direct result of inflammation. So inflammation shouldn't be something that we should dismiss. For example, we start with a healthy liver. After some time, that liver can get inflamed because of hepatitis, for example, or because of chronic alcohol intake. That can lead to hepatitis, chronic hepatitis. Eventually, the liver becomes so scarred and cirrhotic, and it becomes a good organ for which cancer can grow. It's the same mechanism why you develop, for example, cervical cancer. When you have an infection in your cervix because of a virus or HPV, and then you smoke, all the carcinogen concentrate on the mucosa of your cervix, and that can lead to transformation of your cervix into cervical cancer, for example. Now, it is also said that inflammation causes the tumor to produce blood vessels, to make their own blood vessels. It's as if they have their own DPWH. No? Meron silang public works and highway. They create their own blood vessels so that the oxygen that they need to grow, the nutrients that they need to grow, will be siphoned towards them. And inflammation can actually promote that. It is also said that inflammation creates resistance to radiation and chemotherapy. because the tumor can mutate as a result of so many free radicals that inflammation brings in. Okay? Now, what promotes chronic systemic inflammation? Of course, from the environmental toxins, all the pollutants that we have inhaled, all the chemicals from the processed food that we are taking, and then simple sugar. This is not shabu, guys, but it is just as addicting. And your children have access to it, right? It's legal. You can buy it anywhere. Yeah? I tell you, this is one of the most addictive substances, and it can also cause so much destruction in the body. Obesity by itself is already a promoter of inflammation. Your fats are not innocent cells there waiting to bubble up or to be the storage of fat. They actually produce pro-inflammatory substances. Okay? Of course, sleep deprivation and stress. We think, how many of you here sleep like 6 hours on the average? Oh, almost like 60%. 4 hours. Woo! We think that 6 hours is enough. It's not, because studies have shown that 6 hours also produce so much inflammation in the body. The ideal is about 8 hours, okay? And I have a talk on sleep, but maybe we can talk about it in a separate module, and you can learn it from somebody who is the worst offender. I sleep 4 hours a day, and look at me now, okay? Smoking and alcohol, and of course, infections. No? All of these can promote systemic inflammation. Now, the second thing I want to talk to you about is oxidative stress. Oxidation may be something that is not so familiar to you, but you observe this phenomenon every day. Like when you cut your apple and leave it exposed to oxygen, it turns brown after a while, right? Hindi lamang po yung mga fruits and vegetables, kahit bakal, kaya niyang i-oxidize. Huh? Your pipes can get rusty like this. What about the pipes inside your body? Your arteries, especially your coronary arteries, can also get oxidized. And there is this, because of that inflammation, the buildup of cholesterol inside the blood vessels can eventually block that, parang kalawang din, and that cause all these heart attacks. Now, where all these things come from? Free radicals, as you burn food, as you metabolize food, the body releases all these free radicals. And I can tell you, free radicals are unstable molecules. Yeah? Pero luckily, our body also produces our own antioxidants. Examples of these are alpha-lipoic acid. Another example would be your glutathione. Hindi lang po kung pampaputi yung glutathione. They are very powerful antioxidants. So there should be a balance between the free radicals and the antioxidants. Okay? But in our modern world, we are literally swimming in a sea of free radicals. Because of chronic inflammation, as I've mentioned, because of the pollution that we inhale, or even the chemicals that we put on our faces from the cosmetics that we use. Be very careful about that. Processed food also contain a lot of free radicals. The stress that you go through in work, exposure under the sun can also release a lot of free radicals in the skin. Chemotherapy also. So I'm guilty of this. At the moment I give patients chemotherapy, one would expect a lot of free radicals to be roaming around the patient's system. Smoking, alcohol, and of course, infection. So this can put the balance out of whack. And again, trigger a lot of inflammation. So, as you know, free radicals are really molecules that are unstable. May kulang sa buhay nila. Kulang ng electron. Maghahanap yan, mangangagaw pa. Di ba? Mabuti si antioxidant generously will donate its electron to stabilize that molecule. All right? Now, oxidative stress has been implicated in a lot of degenerative diseases, including stroke, Alzheimer's, Parkinson's. In the eyes, the retinal disorders. In the lungs could be asthma and chronic bronchitis, and of course, could be in cancer, diabetes, aging, even chronic kidney diseases. The free radical and oxidative stress can contribute to that. So, as you can see, oxidative stress and inflammation are locked in an embrace. They dance together to reinforce each other. When you have oxidative stress, it triggers inflammation, and inflammation releases a lot of free radicals, which cause further oxidative stress. So paikot-ikot lang siya. We need to break that cycle. Okay? Now, inside our body, inside our cells are what we call. Okay, guys, I will enrich your vocabulary with just 2 words today. NF-kappa B is a protein inside your cell, which in the presence of bacteria or toxic chemicals, they go into the nucleus and trigger your genes to produce inflammation. Its intention is actually to protect you, to protect the cells. The problem is when it gets unchecked, tuloy-tuloy na inflammation. Okay? Then, luckily, we have another ally in the second molecule called NRF2. Anong ginagawa niya NRF? Protein din siya. Pag nadidetect niya na tumataas yung oxidative stress, yung mga inflammation, etc., it will go into the inside the nucleus and stimulate the genes to produce more antioxidant. So, binabalansin niya. Okay? So, question, dapat tumaas tong NRF activity, dapat madampen natin sa NF-kappa B. So, question, what can we do to increase the activity of this molecule that is very helpful to increase your antioxidants, which your body can also produce? NRF2, to increase your antioxidants, you can get it from your polyphenols, plants and vegetables. Curcumin, guys, saan yan? From your turmeric, luyang dilaw. Okay? Sulforaphanes from broccoli can also increase your NRF2. Your EGCG is from your green tea. Okay? So you drink 2 to 3 glasses of green tea. Resveratrol comes from the skin of your grapes. Even better if you take the grapes with the seed, because the secret is in the seed as well. Carotenoids, guys, omega-3 is very good from salmon, avocado, olive oil, because omega-3 is anti-inflammatory. It prevents inflammation, and of course, your vitamin E rich foods. Now, if you can be disciplined enough to take all these things, USANA actually has some essentials that contain very powerful antioxidants already. Okay? So, for my patients, cancer patients who are not eating, kahit pilitin mo yan, hindi kumakain, I have no choice but to resort to supplements to augment green tea, and of course your anti-inflammatory fats from omega-3. Kung hindi kayo kumakain ng salmon, magsasawa kayo ng salmon, there is already a fish oil as well that is available. And this is also available within USANA as well. Now, let me just go to obesity because this is a global epidemic. As mentioned earlier, about 2.8 to 3.5 billion of the world's population are overweight or obese, and in fact, 38% of Filipinos aged 20 to 59 years are considered overweight. That's a lot. That's a lot. It is linked to certain kinds of cancer, including for women, breast cancer, ovarian cancer, uterine cancer, for men, the prostate cancer, pancreatic cancer, colorectal cancer. Marami. So that is why when a patient comes to me with cancer and the patient is on the obese side, I always plan to put this patient on a diet, to move this patient as close to their ideal weight as possible. Because, for example, in breast cancer, if the patient is obese, even if you do chemotherapy, even if you give hormonal therapy, the risk of recurrence, if they are obese, can be as high as 60%. So I make sure that I advise the patient on lifestyle modification once they are on the plump side. I also advise the family members to do the same. Yeah? Okay. The problem now is obesity is getting more and more to the younger population. The prevalence of childhood and teenage obesity is rising. And therefore, the latest CNN report showed that cancer is increasing even among those who are young, 50 years old and below. Padami ng padami, I think it's all lifestyle related. Okay. So all of these things, guys, are interconnected. Oxidative stress, obesity, inflammation, lack of sleep, sedentary lifestyle, poor food choices can all contribute and be confluent upon these diseases like diabetes, cancer, and heart disease. So how do we dismantle this web? You can change one factor at a time. Maybe you need to modify your sleep. Maybe you need to exercise a little bit more. And exercise doesn't mean you have to go to the gym. Maybe walking for just 30 minutes every day for 5 days can already reduce your risk of colon, breast cancer by as much as 25%. So isa-isa mo i-dismantle yan, mawawala, yan, mag-weekend din yan. So according to the American Institute of Cancer Research, healthy diet, regular exercise, and maintaining a normal weight can already reduce the risk of cancer by 30 to 40%. Guys, it's the same thing that you will do to prevent or lessen your risk of heart disease and diabetes. If you do these three things, tatlong sakit na yung ating ina-address. Hypertension and heart disease, diabetes, and cancer by just doing these three. But it is the simple things that make it really difficult to comply with. Who among you here think that they are eating right? Wala, all guilty. There was a survey done of people who were asked, are you eating the right amount of 5, 10 servings of fruits and vegetables? Many of them said, yes, I'm doing this. But when they reviewed the food diary, only 1 in 4 people are actually following the recommended diet, right? Okay. Regular exercise. Sino nag-exercise ng regular? Hindi pa rin. Baka makikita ko kayo sa clinic ko niyan. Ha? Okay. Here is one study of Swedish men. 20,000 to lahat, no? 20,000 men were studied and they were asked to modify their diet, a healthy diet, physical activity, no abdominal obesity, dapat. Guys, mas worse actually yung malaki yung tiyan or minsan payat kayo pero sa loob pala may fat. Ang tawag ko doon coffee, thin outside but fat inside. No? May mga ganong situation, no? No smoking, moderate alcohol consumption. They were asked to modify their diet, and lo and behold, if you just modify one factor, say your diet becomes healthier, you already reduce your risk of dying from heart attack by almost like 80%. You add, say, no smoking, you further reduce it to about another 36%, etc. So you know the drill, right? If you modify all five that I mentioned earlier, you reduce your risk of dying from initially 100% to about now only 20%. The problem is, out of those 20,000 people who were surveyed, less than 5% are actually able to do all five. Huh? Pero guys, okay pa rin. I mean, come on, just modify your diet, just do your exercise, then maybe just doing those two may already impact your risk. I would like to end with this, and this is always my message to people. I see a lot of young people here who probably would say, Doc, I feel fine. I don't need supplements. Okay, ako, I feel strong. I eat normally. Perfect. This is the best time for you to intervene and really modify your diet. Kung hindi pa sira yung katawan. Diba? Sabi ko nga, mas hinihimas pa natin yung kotse natin kaysa sa katawan natin. We give it so much attention. Pinagpa-change oil nyo, dinadala nyo sa kasa, pero yung katawan natin, iniintay natin na magkaganito. Kotse, pwedeng palitan. Yung katawan natin, hindi. Yeah? Walang spare parts sa katawan natin. So, again, that was a wake-up call for me when I almost had a heart bypass 5 years ago. I was financially okay. I was doing well. I have a great career. Pero guys, once your health is really in bad state, nothing is important than your health. No? So please, my last message to you is take a close look at your lifestyle. Lifestyle can prevent diseases. It can control diseases. In some cases, it can even reverse. I was supposed to undergo a bypass already, but I bargained. Lord, wag muna. And then the cardiologist said, okay, we can abort the procedure, but you have to do a massive life change. So I lost 20 kilograms. I played tennis like 3 times a week. I gave up my Red Bull and my coffee. So I lost 20 kg and now I can help you. So thank you so much, and I hope this was helpful to you. Yeah.
Thank you so much, Dr. Alex Delgado. But before we proceed to our next segment, we will first draw the 3 winners of our minor raffle. So who's excited for our raffles? Ayan. May we have Ms. Michelle Arkansas to award our winners. So our first winner, let's have Russell Palmano. Is this right? Palmano. Palmare, I mean. Russell Palmare. Our second winner, we have Philip Aitona. Congratulations. Our third winner, Cheryl Nava. Congratulations. Okay, so we will be taking another one. Let's have Serrano Ninabel. Congratulations, everyone. Now, welcome to Bridging the Nutritional Gap, addressing health issues with dietary supplements. In today's fast-paced world, maintaining optimal nutrition can be a challenge. Dietary supplements can provide essential nutrients that may be lacking in our daily diet. They play a crucial role in addressing specific health concerns and supporting overall well-being. Join us as we explore the world of dietary supplements and their potential to bridge the nutritional gap, paving the way for a healthier lifestyle. Our next speaker is the Executive Director of Global Health Education and Nutrition Research of USANA Health Sciences. He earned his Bachelor of Science degree in Public Health from the College of Public Health, University of the Philippines, Manila. Doctor of Medicine from the College of Medicine, UER MMMC, International Master of Public Health degree with distinction from the Hebrew University Hadassah Braun School of Public and Community Medicine in Jerusalem, Israel. He completed the Clinical Trials Management course in the Graduate Summer Institute of Epidemiology and Biostatistics at the Bloomberg School of Public Health of Johns Hopkins University, Baltimore, Maryland in 2007, followed by many additional trainings on clinical trial management in other U.S. universities and research institutions. He completed the Executive Leadership Program from the University of Oxford, said business school. He has extensive training in project management, and he executed and managed clinical studies to uphold USANA's reputation as a science-based company.
Are you hungry? Diba, malapit na yung, malapit na yung lunch. But I'm happy to be here. Great to be with a lot of health professionals like you. Matagal na akong hindi naka-attend ng medical conferences full of Filipinos. Puro sa US kasi, either whites, blacks, Europeans, but so I'm happy to be here, to be with you all.
So my topic is about bridging the nutrient gap and addressing nutrition-based health issues with dietary supplements. A lot of this has been tackled by our dear speakers, Dr. Tanael, Dr. Delgado, Ms. Del Rio. Thank you so much. It will help me shorten my talk too. So anyway, those who are doctors here remember Hippocrates. I'm sure all health professionals. And Hippocrates said, what did he say? Let food be thy medicine. And what he meant exactly is that foods are not drugs, but what he's trying to say is food is important in having a healthy lifestyle, or nutrition is important. Okay, actually, in the original Hippocratic Oath, when it was translated from the Greek and then modified through the ages, the original translation talk about the remedy should be through diet, but as the changes of the years came, according to the needs of the school or the country, they modify the Hippocratic Oath, but still some of the main components of ethics are there. So, my colleague here talk about food, how important it is. Food is not only to fill up the stomach, that, because it's full of vitamins, minerals, other nutrients that will keep you alive, And it talks here about food can deliver messages to your cells. It's called cell signaling. Dr. Delgado talked about NRF2. That's one way that the food can, prevent chronic diseases. But if there's no food, what is the alternative, There are food-grade substances like dietary supplements. So, the conventional wisdom, yung pinag-aralan natin, sinasabi ng mga science teacher natin from elementary, high school, until college, eat a balanced diet. Pero ano ba yung balanced diet? Not so many understand what is a balanced diet. Sometimes, when we were working in the hospital, sabi namin sa mga pasyente, eat a balanced diet. Go to the nutritionist there. Sila na mag-explain sa'yo. Because in reality, for example, when we were in medical school in the 80s, we only have a few hours of nutrition lecture. Okay? And so after graduating from medical school, I wanted to learn more about nutrition. So I went to study myself, nutrition. And even that time, wala pang nakakaalam masyado ng dietary supplements. When you talk about dietary supplements that time, you're being censured or they laugh at you. Sabi ng mga co-physician mo, ano ba pinagsasabi mo na dietary supplements? Are you what? A quack doctor now? So, but times have changed, because as my colleagues have said, what you put in your mouth matters, Kung anong kinakain mo, this is very important. Especially if I love hamburger too. But right now, I only eat it once every 3 months when I'm craving. I don't eat it every day. I know some people who eat this kind of food every day. On top of that, they consume a lot of soda and other processed foods. And this is American statistics. Many of the chronic degenerative conditions have increased. This was a few years ago, 66%, and now it's up 70%. Why? Because of the way people eat. And if you see this graph here, this dietary factor should actually go up until high blood pressure, obesity, these are all affected by diet. And these are all preventable. As mentioned earlier, if you modify your diet, add to it exercise, okay, and other healthy lifestyle factors, you will actually decrease both morbidity and mortality, the risk. Okay, makita nyo dito sa baba, and some ups there, they're all related to dietary factors. And the RDAs is one thing. This is a favorite topic of the nutritionists and dietitians. You all know what RDA is, and there's a school of thought. Is it even enough? You know, or do we need to adjust it because of the needs of the population? And you know what RDA is, the minimal amounts of essential nutrients established to prevent deficiency, okay? But it's not optimal. That's the argument of many scientists now. And RDA is like having a poverty level income, okay? It's not really answering your needs. That's what a lot of scientists and those involved in nutrition are talking nowadays. And for example, blood vitamin C concentration. If you talk about RDA, vitamin C is good in affecting collagen synthesis. Yan, kita nyo yung red dot doon. RDA prevents scurvy, makes good bones, good gums. But what else can you do? If you go beyond the RDA, using vitamin C, you can prevent fatigue. Okay? Kaya yung mga palaging pagod dyan, baka kulang kayo sa vitamin C. You see this graph? Because carnitine, for example, vitamin C will convert carnitine to energy. Okay? And also in the synthesis of catecholamine. Alam niyo naman yung catecholamine, diba? It will make you go. And then, you increase some more, it will have effect on heart health. You see that? It affects the production of nitric oxide, which is good for circulation. Okay? It also affects the cofactor BH4, which also affects the synthesis of nitric oxide to improve circulation. So you see, to have other beneficial effects, you have to go beyond the RDA. Okay? But how will you do that? We'll discuss that eventually. This one, I think you have seen it before, that the RDA of vitamin C, there's a range, 40 to 125, some countries 80, some countries 120, but the optimal would be 1,000 milligrams per day. How can you consume that without having a supplement? Huh? How many glasses of orange juice will you consume to get 1,000 milligrams of vitamin C? Sinong umiinom ng 10 glasses of juice dito? Anybody? No? It's impossible, diba? Impossible. Even I that is fond of juice, I can only drink 4 glasses a day, not 10. Then, these deficiencies in the Western diet, I'm surprised because when this survey was done in the United States, you would expect that it's a rich country, there's plenty of variety of food, but how come there's still deficiency in this vitamin E, calcium, magnesium, even vitamin B, you see? So, because it's the way people eat. Everybody's rushing, you know, run through the door, wake up in the morning, run to the door, 1 cup of unfortified cereal, you know, and then go to school. School food is not healthy either, you know. Those of you who have been to US, you know, you go to school, there are healthy choices there, but the children, of course, what will they pick? Yung processed food, okay? That's why they end up with deficiencies. What about in the Philippines? These are the common deficiencies according to a survey done by a Philippine agency. You see the vitamin A, thiamine, riboflavin, folate, vitamin C, D, calcium, iron, and iodine. Akala ko wala na yung iodine. This has been a deficiency. This has been deficiencies forever. We were in school, these were already deficiencies hanggang ngayon. Okay. And of course, you have the pregnant women, lactating women, they're prone to deficiencies. And Mr. Rio talked about the elderly, okay? They are prone to deficiencies and estimated, you see, very high. 80% of adults do not meet the recommended nutrient intake for many micronutrients. Kung 80% yan, in the survey, a big survey, the 80% in this room, if we project it, is deficient. Kasama na kayo doon, some of you. Okay? And with vitamin A, you know the function of vitamin A, and it's one of the causes of blindness in the not only in Philippines but the whole world, and it's preventable. Vitamin A deficiency. I remember when there was the international agency. I was still in Philippines, and I volunteered. We have vitamin A deficiency program in CAA Las Piñas, in Navotas, and Malabon. And there were a lot of children with dry cornea. Okay, that is one of the signs of vitamin A deficiency. But after we did the supplementation, there was even the scarring of the cornea. Okay, but at least what was prevented was the more incidence of vitamin A deficiency. So we did the program of supplementation, and in 2 years, we eliminated or decreased the prevalence of these dry eyes, okay, or dry cornea. And that area, these areas that are even near to the urban areas that have a lot of food, but because the people were so poor, they don't have a way to eat the balanced diet. So supplementation worked for them. The other one is thiamine. Nung araw, when we were growing up in the 60s, so now you know my age. we still saw, I was not a doctor then, but I saw, sabi ng mga parents ko, ay, may berry-berry yan, kamag-anak natin na yan. Sabi niya, may berry-berry yung kapitbahay. But now it's very rare. But then there are other things, because thiamine is involved in many body metabolism. So if you're deficient, many of your body system metabolism will also be affected. Okay? And in Philippines, you see, out of the survey, almost 77% is still deficient in thiamine, especially if the alcoholic naman ngayon, mga namomroblema niyan, yung mga manginginom, okay, you will have problem with vitamin B1 deficiency. And when it comes, so moderation lang or better, no drink. But if it comes to the point that you have chronic alcohol problem and it affects your liver, like in the US, they do infusion of thiamine to prevent thiamine deficiency. So hopefully you don't get to that point or you want to prevent it. So the next one is riboflavin. You know, riboflavin, there are some types of anemia that is produced with deficiency, and mataas din. So Philippines, almost 96% of the population are deficient or inadequate intake of riboflavin. And it's very easily solved by supplementation. Okay? So paulit-ulit ko lang sinasabi that there are deficiencies that if your diet is not balanced or good, you can solve by supplementation. And you see this, you're familiar with this. Sometimes you have chalosis, you know, you have sores on the angle of your mouth, other parts of your throat, and other symptoms. Folate. Another thing, Ms. Delgado talked about the effect on the fetus, you know. I was shocked when I became a student in UP Manila and we passed through the Museum of PGH, Philippine General Hospital. And there was a museum there. I don't know if there's still a museum. And there would be babies, you know, that are dead babies, of course, that are preserved. And they don't have, you know, anencephaly, they don't have heads, or they have spina bifida, the baby died, and they put them in formalin. So you would see them on exhibit. So I was so affected by that when I saw those, and I decided, although I went into family medicine and worked in PGAs, worked in the emergency room, that it was traumatic because there are too many patients, and you see patients who are already at the last stage of disease. That's why I decided to go into preventive medicine and public health, because I thought I could help more people rather than wearing the white coat in the emergency room, and I can do much, you know, because they're already in the last stages of disease. You know, that was my impression. Although it was dramatic, you know, people almost worship you, save my daughter, save my mother, but it's too late. It's too late, you know. So I said, I want something that I can do more at the early stage of disease. Okay. So folate deficiency is very useful, especially for pregnant women, because it prevents these neural tube defects. Vitamin C, you know this, one of my favorite vitamins. Maraming prutas sa Pilipinas, but mahal din. But even you eat a lot of mangoes or you eat a lot of dalandan and calamansi, sometimes because of stress, you may need more vitamin C. Or because of the kind of job that you do, you want more energy, maybe you may need more vitamin C. Okay? And you know this, yung mga kulang sa vitamin C, they have poor wound healing, joint aches, loose teeth. You know that classic story about the sailors that went to the ocean and they would have bleeding mouth and bleeding gums. But one of the captains eventually fed them with lemons, and that's how they figure out vitamin C prevents these problems. So maraming story itong vitamin C, that's great. Vitamin D, sunshine vitamin, they call it. Supposedly, we should not have in Philippines because we have a lot of sunshine. But I was in Mexico 3 weeks ago. Marami ding sunshine doon for a meeting. Hindi ako nagbilad sa beach. I went there for a meeting and I realized they also have the same deficiency like Philippines. Same sunny country, but because their consumption of vitamin D is less than 5 micrograms a day. And we should consume 5 to 10 micrograms or 5 to 50 micrograms a day. And you know, bihira na yung may rickets na, but you still have in some regions of the Philippines, the bones are not formed properly, so medyo sakang, you know. And when you grow older, you're prone to fracture of the hips, other parts of your body, because of the softening of the bones if you're deficient. So again, what is the remedy if your diet is not enough? Alam niyo na dapat to. Supplementation. And calcium. Calcium is related also to vitamin D metabolism. And this is also deficient here in Philippines. Especially we are not so much milk drinkers, right? A lot of Filipinos don't drink milk because of lactose intolerance. So therefore, we have to find other sources of calcium. If not the diet, then what? Supplementation. Iron. Hanggang ngayon ba naman, iron pa rin is a deficiency. Ang dami namang kalbos ng kamote dyan. May mga liver pa. But you cannot eat liver every day. You know? I love liver, but I cannot eat liver every day. No? Kakasawa din. Kamote tops. Kung sa Amerika, mahal ng kamote tops doon. Kasi magbibiyahe pa yung kamote tops from Asia, it goes to LA before it goes to Utah. By the time dumating na, expired na. Yeah, wala pang malunggay doon. Yeah. And you know that iron is important, otherwise you also have anemia. It affects also cognitive function and physical function. You know, when I was studying in the Holy Land, they were not talking about preventing iron deficiency. Because they were so advanced that they were already studying iron and how to improve IQ because of the effect on cognition. Okay? Yung ability to do physical work. You're always tired. Maybe you're anemic. If not anemic, maybe you lack vitamin C. Okay? And the doctors, you know, even without laboratory tests, by physical examination, you're able to say what the probable deficiency the patient has. Now we are so spoiled. There's so many laboratory tests. Sometimes the doctor doesn't even look at you. Order na lang, order. Lab first and come back to me. Wala na yung physical exam. You know, during our time, the professor would scold us if we don't know how to do physical examination. You know, there's a whole book on physical examination. You should know how to diagnose a patient without laboratory. Yung mga laboratory, ano na lang yan, susunod na yan. Plan na yan dun sa, remember the SOAP daw, or doctor's SOAP. Lalagay mo na lang dun sa plan at the end. But doctors nowadays, even in US are so spoiled. They depend so much on diagnostic tests. But if you have it, use it to confirm. Okay. And iodine is one of the important mineral that affects the brain. You know, it is one of the most preventable cause of mental retardation. And of course, yung goiter, meron pa rin. 2 years ago, I went to a province. Marami pa rin may goiter. But long time ago, in the 60s, 70s, when we would go to mountain province, kasi bihira ang seafood doon, di ba? When we would go there were a lot of people you can see with goiter. It decreased, but it's still, there's a lot of people, especially in the areas that is not accessible to seafood. Okay? Of course, meron namang iodized salt, but most salt that are used here are non-iodized. Okay? Now you see in the Western diet, we have talked about this, so much processed food and not so much fresh fruit and vegetable. And there's a link with Western diet and non-communicable disease. Like Dr. Delgado said, he was discussing about obesity and cancer because of Western diet, okay? And we need a lot of micronutrients to have a healthy life. So it says here in summary, 70 to 80% of Filipino adults do not meet recommended nutrient requirements. It's true, this was done by a survey in the Philippines, National Nutrition Survey data. So this is recent. And some studies suggest that current recommended numbers for many vitamins may be too low. Remember I showed you that RDA? See, there's even a school of thought now that maybe, especially in US, I don't know sa Philippines to my plan, to adjust RDA. Okay? Changing our diet is often difficult and requires time and commitment. Therefore, an easy way is supplement. Memorize na dapat yun. Supplementation. Because food fortification, alam niyo ba yung food fortification? Nilalagyan ng vitamins or minerals yung food. Kaya lang, it was found out like in United States na mas mahal pa yun. The expense will be so much for the manufacturer and the buyer compared to when they take supplements. Okay? So economic-wise, it makes sense to take dietary supplements as an effective way to fill nutrient gaps. Konti na lang. In US, 4 out of 5 Americans use dietary supplements. Why? This is recent data because alam na nila. Okay, many of the consumers or the public have become educated. Maybe in the Philippines in the future, it will become 4 out of 5 then. Okay, maybe now I don't exactly know, but it would be interesting to hold a survey. So basically, marami na ang gumagamit ng supplements sa US. And these are the major reasons why Americans use dietary supplements for overall health and wellness, immune health, energy, fill nutrient gaps, skin, hair, and nails. Siguro pareho rin dito. If you make a survey, why do you take supplements? Same reason, right? These are the same reasons why you take supplements. So, survey of health professionals and supplements use. More health professionals actually use supplements in the United States. Nag-improve na yan. 10 years ago, takot pa yung, they don't even talk about, especially the doctors, they don't even talk about. They say, why are you talking to me about that? If your urine will just become expensive, This is just quack medicine. But then, it's found out that they have been disproven because marami ng research na ginawa related to dietary supplements. Okay? But look at this, interesting. Physicians, regular user, 51%. But look at the nurse practitioners and dietitians. Yeah? Why do you think they have a high percentage of users? Because they know, they understand, they studied it. The nurse practitioners, dietitians, even the pharmacists, and the nurses, they studied what nutrients are. Actually, mas mahaba yung curriculum nila sa nutrition than the doctors, That's why in US, there's a revision of the curriculum. I think in Philippines too. There's revision of curriculum to include more nutrition as a part of the curriculum rather than just an elective. So among you here, you see, maybe many of you are already supplement users because you are health professionals, you understand what nutrients are, what they can do in the body. Okay. Look at this, relative risk reduction and cost savings. This is in the United States. So pinapakita dito, like those who use supplements regarding heart ailment, there's a relative risk reduction by almost 15.7%. So, decrease in heart attacks. Osteoporosis, decreased 14%, the blue one. The next one is the eye, improvement in vision increase with the use of supplements. Cognitive decline is decreased, okay, by 9.5%. Irritable bowel syndrome, look how big the decrease is, the purple, 34.5, okay, the risk. And cognitive development in childhood when they take omega-3s, the other multivitamins, their cognitive development increased by 10%. Okay? So, and look at the savings. Malabo siguro from afar, but what this table is saying is in billions of dollars, we save a lot of money Okay, similar to what Ms. Del Rio was presenting. When people are healthy, you reduce absenteeism, they become more productive, okay? They're happier, they can think more, focus more. So I really like this table because it shows the importance of having supplements. And this is already supported by a lot of data. Hindi na magic yan. You know, this is not marketing thing. This is scientific, okay? And this is, you see from the 1920s until now, because there has been, nung araw, sabi ng mga doktor or scientists, they say, oh, wala naman scientific backing yan eh. That's only marketing hype. That's only, you know, gawa-gawa lang yan. That's the major criticism on supplements before, is there were no research done, there were no clinical trials done. But look at the research done. Starting 2000, it started to spike. And it will continue, okay? Like our company, USANA, we make clinical trials for products we are not required to do, but we want to show to the world, to add to this data, that dietary supplements work. It's not only guess. It's not a marketing hype, okay? That's the only way you can prove to the scientific world that it works if you have data. Otherwise, it's a guess, okay? So I like this graph too, because this has been a criticism before. There are no data on efficacy of dietary supplements. There's no data of safety, but there's data on safety. In USANA, for example, we have a safety monitoring section. We monitor the safety of the products, okay? So in general, with all the evidence that have been shown here, marami pa, but there's no time, right? The rational use, this is the final conclusion. The rational use of nutritional supplements combined with a healthy diet, exercise of course, will contribute substantially to health promotion and disease prevention. And this is basically what my colleague presented earlier, you know? See, rational use of supplements. Because meron namang irrational use. Kaya what we want to say to you is there should be a rational use. So what is rational use? Whereas health professionals, you don't just take it as it is. You have to do your own research. If you come across a supplement, you have to research the background of the supplement. You have to research the certification of the supplement. What are in there? Baka naman yung mga ingredients, ano lang yan, nilagay lang yun. Very small amount, just to show that there's an ingredient. But when you test them, it doesn't work at all, right? So there's many more that we can discuss, but maybe it's more appropriate in a separate setting. If you want to discuss per product, that's a different topic. But thank you all for coming, and hope to see you again soon. Tomorrow, actually, I'll see you. Thank you.
Thank you very much, Dr. Maddela. All right, in this segment, we would like to welcome you to the Health Symposium panel discussion. And by the way, we'll be setting up microphones. We actually have microphones right there in the middle. So if you happen to have any questions or anything you would want to clarify with our speakers, then please feel free to raise your hand and we'll accommodate that. So joining us again in this segment, we'll be having Dr. USANA, Dr. Alex Delgado, Ms. Mary Rose Del Rio, and Dr. Rolando Maddela.
Thank you, Sir Leo, and good morning again to our speakers and to everyone in this hall. Okay, so my first question is for Ms. Mary Rose. Hi. Ma'am, what are the specific nutritional requirements for different age groups, such as infants, adolescents, adults, and the elderly? Okay, so that's a very long answer, which I just presented earlier. So for adults, there are a lot of nutrients definitely that includes not just your water soluble and water soluble vitamins, your B vitamins, your vitamin C. So when you say fat soluble vitamins, that's your vitamin A, B, and K. And apart from that, a lot of minerals as well. So there's a list of them which I stated earlier. So I hope you were able to get a screenshot. Okay, so thank you for that. Since you've mentioned that we have a lot of nutrients needed for those different stages, how about we narrow it down into during pregnancy and early childhood? Can you name some of those nutrients? During pregnancy, number one, folate, which I mentioned earlier, folate, B3, B12, right? The vitamin for the fat soluble, you have the vitamin A, B, your choline. So yeah, and the others. Your minerals, definitely, which I also mentioned earlier, your iron, your zinc, etc. Okay.
All right, thank you very much, Mary Rose. Now, this one is for Dr. Tinayal. Doc, what are the key factors influencing gut microbiota composition and diversity?
It has to be a holistic approach. So as I emphasized, number one is adequate sleep, my friend. Okay, because it really is a very important recovery period for everyone.
Yes, with exception to the people who attended the event last night.
You can sleep later, and then of course the physical activity, because exercise does do promote the growth of those friendly microbiome in our body, and of course the stress management, no, yung share, you know what stressful lifestyle is, no? So chill lang, chill, and then last of course are the vague lecture we have always have balanced diet. Ano nga ba talaga balanced diet? But food rich in fibers, prebiotics, and intake of probiotics. Simply lang, it's almost all, it's the generic, it's the common advice or coaching that we provide to almost all types of diseases.
I got it, Doc. Now, so Doc, I just want to tap with something very now, because it's very common. I mean, now it's mental health is not a new issue now. It's not a taboo anymore compared to the years back. So I just want to ask about the how does gut health impact overall health, immune function, and the mental well-being?
Most of the studies that we have in mental, because to be able to state causality, you should have, may mga design siya to establish causality, like randomized controlled trials, and that there should be outcomes that are measurable. However, there are limited studies. Most of these studies that I've encountered are the capacity of the research design is at the most
association or correlations, wherein changes in the population or in the types of microbiome found among these patients with mental health disorders such as depression, anxiety, or even with schizophrenia, or even epilepsy, are closely associated with changes in this microbiome, etc. But there's a study done in the United States among college students who are in their dormitories. Wasn't able to put it in the slide, and they tried to study the overall quality of life of these patients, of these students who happen to have respiratory tract infection. So the question was, pag nagbigay ba ng probiotics among those students in the dormitories living in the university, and if they get sick with 40 for that matter, ano kayang quality of life nila? So they found out, comparing those that received probiotics versus those that did not receive probiotics, the quality of life is much better among those that receive probiotics than those that do not, despite the fact that they had 40 or respiratory tract infection. That is what I gather from, I mean, if quality of life can be a surrogate marker of mental health for among the people, then that's a very nice study that I encountered.
Thank you very much, Doc. So if you happen to need the probiotics, you can just go to the customer service for that. It's a simple, like, and by the way, our cutoff is 1:59 p.m. to that this afternoon.
Sa akin na lang, para na makinig ko.
Sure. All right, no problem, Doc. Ninya.
Thank you, Dr. Chanel. I just remember something like the gut-brain axis or how they are connected with each other. But anyway, it's a different topic. We can talk about that on the other time. So my question now is for Dr. Alex. Hi, Doc. You've already talked about how stress affects us on the different aspects of life. So my question is, how does oxidative stress contribute to the development of chronic diseases such as cardiovascular disease and cancer?
So I think you've seen earlier yung dalawang loops, di ba, that are feeding each other. Now, a lot of these stresses, for example, not just oxidative stress, yung stress ng life, you're not sleeping. Your lack of sleep puts your sympathetic nervous system in overdrive. Your fight and flight mechanism is upgraded as if may kalaban kayo pero wala naman. That causes a lot of strain on the heart because it has to pump harder, you know. It causes your heart to literally be put under strain unnecessarily, only because you don't sleep. Okay? Simple lang ang solusyon doon, matulog. No? And I don't blame you if you sleep today because, I mean, that's healthy. Yeah.
Thank you, Doc.
Yeah, but before, Dr. Chanel would like to add something on what Doc Alex just mentioned.
I like the question about how it's related to the cardiovascular system. Medyo maayos pa yung memory ko kasi kali-lecture ko lang kaya gusto ko i-share sa kanila. Okay, let's see. Lagyan natin ng konting pathogenesis yung relationship na yan kasi there's always a fetal cycle between oxidative stress and chronic inflammation, okay? Oxidative stress, free radicals, is exposure natin sa environment, the food, stress that we have. And that causes release of a lot of free radicals if we are overwhelmed. So oxidative stress results in chronic inflammation, futile, nagiging oxidative, contributes to oxidative stress. The question is, where does that happen? Kapag may mga chronic inflammation and everything, ang pinaka-nangyayari yan lahat ay sa endothelium, which is found at the innermost layer of the cardiovascular system. And you know that this endothelium is everywhere in the body, right? So sa katagalan ng inflammation na yan, mga plaques, mga cholesterol deposits, etc., contributes to atherosclerosis that could affect the hardness, etc., of our system. Now, the problem also is oxidative stress, chronic inflammation, chaos in the cell, right? And if it is chaos, who are you going to call? The ghostbusters or the immune function? The immune function, nangingialam yan, right? Eh, nasisira ang endothelium. Kasi ano mangyayari? They will attack the endothelium, further deteriorating the integrity of the endothelium. At kapag nakaroon ng chaos, nakakagulo, ano mangyayari? Kailangan ng energy. O, sino ngayon na maapektuhan? Mitochondria. Tapos, ang nangyayari naman ng mitochondria na overload. Kaya tuloy, nasisira, kailangan natin ang lahat ng mga supplements like for thiamine, riboflavin, etc., etc.
Wow, that's a very short description of your pathogenesis for cardiovascular diseases. Anyway, thank you so much, Dr. Nael. My next question is kind of related to what you have discussed, but I'm still going to give this question to Dr. Alex. What role does chronic inflammation play in the pathogenesis of obesity and metabolic syndrome?
Actually, you remember that obesity and diabetes almost go hand in hand. Kaya tawag natin diabetes. Di ba? Yeah, diabetes naman siya talaga. Now, as I was mentioning earlier, it only takes inflammation to push the patient into diabetes if you already have the three pre-existing conditions. If you are obese, you are not eating well, and you are not exercising. All these preconditions coupled with inflammation can potentially push the patient already to manifest diabetes. No? So don't go there before. Kung meron na kayong mga ganong condition, try to eat more anti-inflammatory foods. Remove those that promote inflammation. This processed food is one. Ano pa? Even yung mga too much red meat can induce inflammation, especially the way you cook it, di ba? Sabi na pag grilled daw, ang tendency is for the animal fat to drip into the charcoal at yung usok babalik to join the meat. And all these can create so much inflammation as well. Maraming factors pa. Stress, of course. Lack of sleep is one of also. Lack of exercise and even over-exercise are also pro-inflammatory. No? So, wag masyadong magpaka-toxic sa gym. No? Okay lang. Chill lang.
All right, thank you very much, Doc Alex. Now, this one is for Dr. Maddela. Oh, by the way, for everybody in the house, I just made it very casual, everyone in the house. Like everybody in the hall, if you have any question, you can just simply, we'll be opening the floor later. Just have to go to the microphones right there, and we'll be entertaining all your questions, just in case you happen to have one. Now, Dr. Maddela, what are the common nutritional deficiencies seen in the general population, and how can dietary supplements help bridge this gap? I know you mentioned this thoroughly earlier, but maybe you can give us a brief, quick approach on this one.
Yeah, like for example, in Philippines, we saw the data, iron deficiency is still a problem. You still, even it's a sunshine country, you still have vitamin D deficiency and all the other vitamin C, even if you have plenty of fruit here. So the easiest way is really to take supplements. You can eat a balanced diet. That's the most conventional advice. The best thing is you eat a balanced diet if you can. But if you're rushing every day, you're lazy to cook, maybe it's expensive to buy all the ingredients. The easiest way, as I mentioned, like in the US, they did a study, it's even cheaper to consume a supplement than to buy a fortified cereal, for example, or a fortified bread. So both the manufacturer and the consumer economically will suffer, you know. So not because I am in a supplement company, I'm advocating it, but I've discovered myself, you know. I'm already 66 years old, or I feel like 40, you know, because of the because of the energy. I'm not making a disease claim, okay? It's non-compliant, but anyway, what I'm trying to say is it really helps, you know, to fill in the nutrient gaps.
But I think, Doc, we don't have the compliance people around. So we can do whatever we want to do.
And also I have to follow the advice of Dr. Delgado to sleep. So after the meeting, I'll go sleep. Because I've not been sleeping for 3 days now because of jet lag. I was only sleeping 2 hours, 3 hours a night. So I'm going to sleep, Dr. Delgado.
You're in good company.
We'll do that. We'll do that on Monday, Doc. Because we still have the event until tomorrow. So, Dr. Maddela, one last question for you. How do dietary supplements contribute to optimizing health outcomes in individuals with specific medical conditions, such as vitamin deficiencies or gastrointestinal disorders?
Yeah, I think this was discussed thoroughly by the 3 speakers, you know. And for example, for cancer, Dr. Delgado talked about is antioxidants, you know, that they really help, like especially those that increase the NRF2, cell signaling factor. And there are many cell signaling factors, hindi lang NRF2. If you go, we were doing a paper on what kind of cell signaling factors are affected in the body. And there's so many affected by nutrients, okay? So maybe in another session, you will learn that when you take a certain multivitamin mineral combination, it affects the increase of antioxidants and therefore produce chronic disease. Prevent chronic disease, okay? So there are many ways that supplements can prevent chronic diseases, you know. We even have shown the graph here about, you know, there are many dietary factors that predispose to chronic degenerative diseases that if you only correct those deficiencies, then you will prevent those chronic degenerative diseases. Yeah.
I agree. Yes, Doc.
I mean, I just find the subject of sleep very interesting.
We're gonna do it on Monday, Doc.
Yeah, I mean, I just wanted to add that lack of sleep can actually increase your chance of conceiving because in short, nakakabaog. Okay? Masakit man pakinggan pero it decreases sperm production by 30%. So I can excuse the men folk if they want to go out and sleep now. But really, guys, you have to take that seriously. Kung nahihirapang mag-conceive, so maybe you don't burn yourself through the night trying to create a baby. Magpahinga kayo. So think about it. No? There are other things I'd like to discuss about sleep, but we'll reserve that for another day.
All right, but before that, let me just remind everybody that the opinion of the doctors, invited doctors, are their own for own discretion, and it does not reflect the notion of the company as well. And all these other products are not intended to cure and mitigate any diseases. It's intended to help and support your health. So by the way, we are actually ready for the questions. If there's anyone in the crowd who are willing to ask questions, just please proceed there at the microphone in the middle.
We have one question here, Sir Leo.
Yes, sir, please state your name and then the person that you're going to ask the question to.
Hello, good noon, everyone. First of all, I would like to say thank you for USANA and the speakers for giving us a very informative lecture and learning opportunity. So I'm RJ, and together with my wife here, I'm a practicing pediatrician from Cebu. So my question is for Dr. Ives.
Okay. My
question is about what's your say on the duration of probiotic use, because some experts would say that prolonged probiotics use is beneficial, and some also experts would say that prolonged probiotics is also detrimental to the health, especially if you use it in immunocompromised patients, and it will increase the immune inflammatory cytokines, or it will increase your lymphoid aggregates, and even detrimental to the health. So, do we have a specific guidelines, or what is your advice to our clients or to our patients on how long should we use the probiotics? Thank you.
Pinas ko yan, pero wala akong nakita study that showed that there's really a prescribed that will show the length of use of probiotics. So there is no study to support that if you use this much, this is the efficacy, etc. But as physicians, we always have just to be guided by our clinical eye on what's best for the patient. Or if you have some journals, just like what I shown to you about the bifidobacterium, that they gave it for 4 weeks and they saw an improvement in the bowel movement. So that might be useful evidence for you to follow on. Pero beyond that, there's really not much about the duration on its use. Kasi safe naman yan eh. So there's no harm using it the way you see that the patient is reacting to it. You know, we just have to be more clinical about it.
Right.
Thank you so much.
I want to add to that. You know, we have safety monitoring program, and we have people that have been taking probiotics continuously. Okay, I'm just sharing my experience, not referring to any journal, but there were no adverse events. You know, they did. Kasi yung iba naman, I don't know where they got the information that you should, after 4 weeks, you should stop, then continue again. I did not see a reference like that. But in terms of safety, they were consuming probiotics continuously, 3 years, 4 years, there's no issue. Yeah.
And regards to safety, I think as physicians, when a product is registered and we see adverse events, we are supposed to report that. The problem is physicians do not report if they see adverse events. But in other countries, that's very, very important. But the fact that and if you are a company that sells these supplements and these pharmaceuticals, we always receive those information and changes in the label on cautions or precautions on what to and what not to. But we haven't, for the case of USANA products, I haven't released, especially for the probiotics, I haven't seen any label that will show that are adverse events or that will prevent us for prolonged use. So that for me is quite a good indicator of safety for our probiotics.
I want to address that issue about immunocompromised patients. Kasi I deal a lot with patients who are on chemotherapy. Kasi ang tanong nila, Doc, mag-i-introduce ka ng bacteria, baka lalong makasama sa pasyente. Because right after chemotherapy, you really wipe out the gut microbiome. No? So, either you repopulate that with the good bacteria, or you let the bad bacteria take over. No? So for me, the risk is so, at saka kung hindi naman bumabagsak ang white blood cell niya, I don't really see any issue. Kahit sinasabi ng iba na, pakainin ng raw food. Kasi baka madumi, well, I can understand that. Pero kung nahugasan ng maayos, the white blood cells are okay, kahit na-chemo naman. Hindi naman bagsak yung white blood cell, I'm okay for them to eat vegetables, for that matter. Pero dapat hugasan ng maayos because the vegetables are also helpful for the patient's recovery.
Thank you very much, Doc. You know, I seriously enjoyed listening at the moment. I'm pretty sure a lot of you guys are enjoying as well and learning a lot of things. You know, silence means, you know, productivity is happening in the brain. All right, sir. Doc, I think you have another question.
Last na lang.
Sure, Doc.
Anyone can answer. It's still with the probiotics. So, is there a specific species that is superior to the other one, or are we after the number of colony forming units when we use the probiotics?
I think both are important. I don't know, Dr. Maddela will probably answer.
Go ahead.
Yeah, so I think the colony forming unit is important, but also the species. No, kasi for me as a cancer specialist, I have learned that at least in the USANA, the species there are the ones that you normally see in normal people colonizing the colon, and having those kinds of species are actually helping the gut from forming all those chemicals from their metabolism that can potentially harm the lining of the colon. So that for me is important. Not only the species, but also the number of colony forming units. So,
Yeah, and also the kind and strain of probiotic that is put there are really the ones that work. If you go to the market, you see all kinds of probiotic, diba? Yung iba nilista naman doon ng 10 probiotics. But that's more a marketing thing. There's really no research on why they added those probiotics. But the probiotics, kasi we get those questions from you. Why do we only have 2 probiotics in there? Yeah, there are only 2, but they're the ones that work, proven by research and science. If you go there to the market, sinabi ko nga, ano lang yun, decoration yung iba. You know, maybe out of the 10, maybe 3 is working and maybe 7 is just fairy dust. Yung sabi nila, ano lang, just to show that they have a lot of probiotics, you know. But of course, you also have to do research on the probiotics that you see on the label. But you see that you're familiar with the label that we have. If you look at it, you research on it, they're really the ones that have a lot of effect in the body. So,
Dr. Chanauli, would you like to add?
Yeah, regarding that question, importante talaga yung type of bacteria, microbiome, and especially those that have been proven by science to be efficacious or provide benefit. The density and then the distribution. Alam niyo, ang dapat makita natin sa relationship ng microbiota with our gastrointestinal tract. Wala namang iba yan sa ecological system like in the forest, in the fresh water. Kapag nasira ang balance dyan, nasisira rin yung ecosystem. Diba? Kaya nga noon, di ba, may mga introduce na mga golden snail at turn out, sila pala kumakain ng iba-ibang species doon sa lake, etc. So that destroyed the ecosystem. Ganun din naman ang it's just a manifestation at the cellular level. The importance of maintaining the homeostasis and the balance of the type of organisms found in the gastrointestinal tract. And yung mga inilagay natin sa probiotics na yan, pwede yung mga proven na beneficial. So kahit may sakit yan, pwede inumin yan kasi normal part yan. Hindi magre-react ang katawan at hindi yan makukonsider na foreign invaders of the body. Kaya okay lang. Chill lang yun.
Yes, God. Thank you very much, Doc. So if you want to have, a happier, healthier life, a chill life, you know where to get all the probiotics. So do we have any other questions? We got one more question.
Good morning, everyone. Deus, I'm one of the Ruby directors here in USANA. I would like to really commend this event that sana po hindi lang ito one time, magkaroon ng mas marami pang ganito. Because for the past years I've been here in USANA, this is the first ever health symposium na sana mas maulit na maulit pa. So my question is, there is a product that will be launching tomorrow. This is actually the Advanced Collagen. And I wanted to know more from our dear speakers I know there will be a discussion tomorrow about Advanced Collagen, but maybe you can share more now on how this
new product of USANA, is there any like could be helpful for the oxidative stress or microbiome or gut health that would be very important to share to our clients and of us who will be using this new product na excited na po kami lahat because the tumbler and tote bag. Okay, yun lang po. Anyone could answer po. Thank you.
I'll turn to Dr. Maddela kasi I think he knows the product better than us.
Yeah,
Am I
Dr.
allowed
Maddela
to
for call.
answer because it's for tomorrow?
Okay.
Bakit masyadong excited? Relax lang, darating tayo dyan bukas.
Chill lang.
O kasi mapipreempt. Huwag naman, sayang naman. Tomorrow, promise.
Alright. So by the way, the collagen is already available tomorrow. So you can claim your collagen at the Merit Grand Ballroom if you still wanted to buy the tickets for our grand celebration tomorrow as we celebrate 15 years of USANA in the Philippines. You can still grab our customer service is still open until 1:59, or for the sake of everybody, you can just go there at the back. We have our customer service people there and we can process everything for you today. All right, so if you need probiotics, you just go right there at the back and they'll process it for you.
Dapat ikasama sa raffle today.
And collagen.
Raffle today, di ba? Collagen.
Raffle today the collagen, Miss Jara.
Intriguing.
Everyone gets, you know, sometimes if you are after freebies, you're not helping business. We'll get to that. We'll get to that moment we're going to give you soon when it gets very, very well. But all we need now is, you know, to enjoy the moment and learn from all our speakers. Now, do we have more questions? There you go, ma'am.
Okay.
Yeah.
Yeah, you said the recommended number of hours of sleep is 8 hours. So, okay lang po say 2 day and 6 a.m. ka matulog pero 8 hours.
The question is, you mentioned, Doc, earlier that the recommended amount of sleep is 6 hours. Now, her question is, what if you say you sleep in the morning or a different timeline, but still 8 hours?
Okay.
Does that count?
Well, better than sleeping for 4 hours, staggered. Pero may mga disadvantage din yan. No? Because during the first 4 hours, most of the time, nasa non-REM sleep tayo. Hindi rapid eye movement. Non-REM sleep, the brain discards all those garbage that you have accumulated during the day. It is during the latter part of your sleep when there are more spikes na mga rapid eye movement. And it is during this rapid eye movement actually where you integrate knowledge, your memory is developed, your creativity comes in through the dreams. Diba? Eh kung 4 hours ka lang, tinigil mo na siya, okay, later ng hapon, matutulog ulit ako, di na non-REM ka na naman. Diba? Walang time for the so-called REM sleep to really continuously develop. And here is the study, 1960s. There was a study done of volunteers. Nilagyan ng electrodes every time they go into rapid eye movement stage. The research assistant will come in and gisingin sila. No? They did that for a week. By the third day, because of you depriving these patients or volunteers of rapid eye movement sleep, they develop signs of psychosis. They become very irritable. They become very praning, paranoid. They develop hallucinations. That's scary. The only thing that separates between rationality and insanity is rapid eye movement sleep. So, kung hindi talaga makatulog, pwede na mag-makeup. But again, I'm telling you guys, don't take sleep like your credit card. Uutangin ko ngayon, babayaran ko sa weekend. It doesn't work that way. Huh?
Yeah. Doctor, thank you for the information, but my question
sorry.
was really, like, if I sleep 4 a.m., then have 8 hours sleep, is that okay?
That's, for me, meron kasing tao na morning people, morning person sila. They work best in the morning, pero patay na yung kanilang utak pagdating ng early evening. Meron din naman na night owl. They work best during the night until 2 o'clock in the morning. I'm like that. Now, okay lang po yun, na tuloy-tuloy, kahit late kayo pero nagigising naman kayo ng mga say alas 10 ng umaga, pero importante that you keep the room dark. Kasi pag may light na pumapasok sa 6 o'clock in the morning, tulog na kayo, pero even that light can already disturb the formation of melatonin in your brain. Because the brain, the pineal gland, wants to produce melatonin in the dark. So, kung pagka alas 6 ng umaga, the sunlight is flooding into your room, it's good for your vitamin D, but not good for your melatonin. Yeah.
Thank you very much. Well, like, I'm really enjoying this moment. I feel like I'm going to have a final exam later. Yes, it's like I think but this is like I'm one of the few non-medical personnel here. All right, we got one more question.
Yes, thank you for this
Our last question.
training. And I'm a practicing licensed occupational therapist for pediatrics. And this question goes to Miss Mary Rose. We have clients in the clinic who have aggressive behaviors, like they're hitting. Up to what extent does the omega-3 fatty acids or our supplements support their mood instead of resorting to medications to stabilize their behavior or mood? In terms of mood management, I think if I would say that our product would address that, then I think that would be a claim. Am I right, sir? But
Right.
somehow, in terms of calming those, I think apart from omega-3, proca, am I right? Somehow the ashwagandha has that benefits in terms of making those in terms of mood management. Right, but of course that has to be, I think, consulted also with the physician of the child because we have to know up to the extent of the case. Yes.
Right, and it's always good to consult the physician rather than just browsing the internet, just asking or just picking up anywhere else. The private doctors of each patient got more important or got the more valuable insight about the patient rather than asking somebody else. I think that makes sense on that matter.
And
Sure, Doctor.
This is a common question kasi na sa ganda kasi ng supplement, minsan naiisip natin na treatment sa disease, no? Always remember it's a supplement. It supports the healthy part of the body, the healthy cells. So when we have questions like, should we give this to this type of disease, etc. A better approach there is really, ano ba talaga ang guideline regarding the treatment of this disease? And is there evidence that providing this supplement could really be beneficial to the person, to the human being? So mas maganda siguro isipin na, our body are made up of population of cells, right? At pag may sakit, meron diyang healthy cells, meron diyang may konting sakit na cells. So when we take in those drugs are meant for those that are not so healthy cells. But if we take supplements, those supplements are supposed to help normal cells or healthy cells and not so healthy cells. What I'm saying is, the reason for that is if you give supplements and help these healthy cells be optimized, baka sila mismo makatulong sa pagpapagaling ng may mga sakit na cells. Wala namang pinag-iba yan kapag may ang isang community na devastate, nagtutulungan, di ba? Bibigyan yung may mga that's the way, yung ibang mga magaganda ang medyo maayos pa, nagtutulungan. So let's look at our population of cells as a social, as a community helping each other. And supplement plays an important role in providing support for the community that we have, which are the population of cells in our body.
And also this supplement, they act on this population of cells. That's why we talk about cell signaling. It's still a lot of research is going on about cell signaling, about how the supplements can talk to the target in the cell, and the cell react, transforms, and produce the desired result. Actually, we published a paper on that, on how cell signaling happens in the body. At maraming cell signals sa body na maraming turn on, okay, in order to get the desired result. Matrabaho lang. We have to discover the many cell signals. But you already mentioned NRF2, that's only one, but there are a lot more. Yeah.
All right, and I think you guys will be very much excited for all the other upcoming products, but I don't know, I just can't mention anything. Because I remember
it's a guy who asked about collagen.
I'm pretty sure a lot of you guys are excited and trying to, or dreaming that I'll slip my tongue somehow. But when I asked Dr. Maddela the other night while we were walking from the restaurant, going to his hotel, I asked him, but unfortunately, he didn't say anything to me as well. So, although I have some ideas, but we just have to keep that. It is how you just have to just enjoy whatever we have right at the moment. So, thank you very much, doctors, Ms. Galleria, for that. And I would like to ask this final moment, like, do you have any final message to all our medical professionals who joined us this morning? Dr. Taneo, chilang tayo. Sorry, Doctor.
Okay, thank you for the opportunity to USANA Philippines, and Dr. Maddela, and of course, my dear friend Alex, who recommended me to be a speaker here. So, grand performance to ngayon.
Sure, Doc. But actually, it can even be grander. If we
first, rather.
Okay, the first one. So, Doc, we can have a second one. Good morning, USANA.
Depends on.
We can talk about that, Doc. Right, I mean, would you like to see Dr. Tonelli? Good morning, USANA. So, Doc, please take on my show tayo ng Joke on that. So, Dr. Alex Delgado.
Yeah, so I'm very passionate about nutrition in preventing conditions like many you are facing. But I find a lot of resistance from my fellow doctors. Para bang, ano nangyari sa'yo? When you talk about nutrition, sometimes they frown at you. I think it's because many people have lumped supplements with scam, right? I don't think they are objecting to the use of nutrition per se, but maybe because of some claims of some companies na huwag ka nang mag-chemo, ito na lang, gagaling ka dito. Di ba? So, nasisira. But guys, please help me spread the word that we need to take care from the prevention stage pa lang tayo. Kasi wala na pagdating na ng mga stage 4 stage. Wala na. Wala tayong magagawa. So please, partner with me and with this team to spread the word of prevention. Yeah.
Thank you very much, Doc Alex. Mary Rose, do you have any last words?
Probably the first step in applying what we have learned today is making yourself your optimal best, right? What I mean is that you can influence a lot of people around you and it can create a ripple effect, right? You'll never know if your sister or your friend can be inspired by you just because you sleep properly, right? 7 to 8 hours, or you go to the gym regularly and so on. So let's make ourselves the first project, and then eventually we can be a community of healthy individuals. Thank you.
Dr. Maddela.
Again, maraming salamat for attending. And whether you like it or not, you are influencers like Taylor Swift or Madonna. Okay? You are influencers because you are health professionals. Okay? And people go to health professionals for advice. And therefore, this is an opportunity for you. You learn so many things today to explain about supplements, especially to your colleagues, because there's such a fear of the unknown. Siyempre, hindi makikinig yung colleague mo kapag hindi niya naiintindihan yung pinagsasabi mo, right? So you have to explain, you have to do your research also. Don't just depend on what we say or what you see on the website. There's always independent investigation of truth. So you're health professionals, you're brilliant, so you should do your own research about, especially supplements, because not all dietary supplements are the same. Sorry to say that, but there are bad eggs out there, and they don't have quality control. There's no quality assurance. It may be safe but not working. It might be working but unsafe. Mga ganun ba? So this is my advice to you is you do your research, make sure your data supplements are made with good manufacturing practices. One last story before we close is, like in US, maraming mga unscrupulous people. They make their own supplements on the table. Parang nag-mix-mix lang ng harina. And then, but they make beautiful labels. And they fool a lot of people. Like a few years ago, this lady was making millions of dollars. But people were getting sick. And therefore, the authorities got involved. Yun pala, her products were all contaminated because there's no good manufacturing practice. So eventually, she landed in jail. Okay, so we have to make sure the supplements that you use, you buy, you recommend, are all made with good manufacturing practices and well researched. Thank you.
Thank you very much. And just to add that, for those people who are not aware, USANA, our manufacturing plant, got GMP certified by the Food and Drug Administration of the United States of America. For more accolades about that, you can check our Instagram. We all have our posters in there. You can also check our Facebook account, or you can also grab all those materials in our Viber community at USANA Pilipinas. So, thank you very much to our guests, but this time we would like to call in on stage Ms. Michelle Arcansabi. Ms. Joyce Hermosillo is back to hand in the certificate of appreciation for all our guests.
Okay.
First of all, I'd like to thank all of our guest doctors this morning. Maraming salamat po for taking time to be with us on our first ever health symposium. Please give a warm round of applause to all of our, should I say, lecturers or speakers for this afternoon. May we have the certificates? May I also call in our marketing manager, Ms. Jara Tayamen, to hand the certificates and our gifts. And of course, maraming salamat din po to all of you who took time to be part of our health symposium. I know Saturday is a very hectic day, a very busy day for all of you medical professionals, but you still gave it a chance to be part of something valuable to the society, of course, public health and health in general. Maraming salamat po, Dr. Gibbs Sanael, Dr. Alex Delgado, Mary Rosario, and of course from the United States, Dr. Rolando Maddela. Yeah, mas small token, mabigat lang po. And then let's just have a quick photo. And before we close this session, we would want to let you know that, of course, we'll be having lunch, we'll be serving lunch. But other than that, if you would want to know more about the company, about the business, or even about nutrition, talk to the person who invited you. Of course, it may be a USANA associate, somebody who will best explain to you what our company is all about. Maraming salamat po from the bottom of our hearts. We would really want to have the healthiest family on earth and have a happy lunch. Thank you so much.